at this, we can spread out.
Well, good afternoon, good evening, and welcome to today's board meeting. I'd like to call the meeting to order. Roll call, please, Mrs. Harrington.
Mr. Bennington?
Here.
Mrs. Down?
Here.
Mrs. Eubank? Ms. Lymer?
Here.
Mr. Coleman?
Here. At this time, could you all please stand for the Pledge of Allegiance?
I do that every time.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, Perrysburg Schools like to welcome all of you who are viewing this evening. For those that will be reviewing during the replay later today or tomorrow. And welcome to the board members and Superintendent Hostler and Treasurer Mrs. Harrington. At this time, we have a few agenda changes I'd like to call out to your attention before we adopt the agenda. I would like you to look at remove point 8.0, 8.0, we'll go to 4.2. So we're going to remove from the consent agenda the June 2020 financials. So that would go to 4.2.
Why are we doing this?
We want to get that out of the consent agenda.
Why?
It was requested by a board member.
Makes sense to put it with the treasurer's report anyway.
Yes. Also, 9.4, summer youth sports camp workers. That will be moved to 13.1. That's 9.4. We'll go to 13.1. And then
Oh, there it is. Okay.
And 13.1 will become 14.1. Does that look about right, Mr. Hostler?
Yes, we've reflected these in the agenda that's posted right now.
Thank you. Any questions on those changes?
So 14.1 will come after board discussion?
Yes.
Okay.
Okay. At this point, we'll take a motion to adopt the agenda.
So moved.
Second?
Roll call, please, Mrs. Harrington?
Mr. Bennington?
Yes.
Ms. Lymer?
Yes.
Mrs. Down?
Yes.
Mrs. Eubank? Mrs. Eubank?
Yes.
Mr. Coleman?
Yes.
Are we going to be able to hear her any better?
I can barely hear you guys.
Okay.
Come on, Brent.
Okay, at this time, we'll have the superintendent's report. Mr. Hostler.
Yes, thank you. And,
Hello.
And good afternoon. So we have with us a guest today that I'd like to introduce. We first heard Dr. Jennifer Hanrahan about 2 months ago when she spoke to about 50 superintendents and talked about COVID-19 and what it means and how it's passed and what's really fascinating is while many of us are Facebook certified infectious disease experts, Dr. Hanrahan is actually a living, breathing, lives in Northwest Ohio infectious disease expert. So we're very grateful that she took the time out of her busy schedule to join us today to just talk a little bit about, from her perspective, what she knows about the disease, the spread, especially as it applies to our situation here. So she's been very gracious with providing great information. Some articles and things that I've shared with all of you have actually come from her. So it's been very it's been great to have such a wonderful partner here in the community who's willing to help out. So with that, I'll turn it over to the doctor and after she speaks, there's opportunity for questions among board members. So thank you, doctor. I hope you can hear us okay.
No, I'm having a lot of trouble hearing you. I'm actually thinking maybe I should drive to where you are because I don't think this is going to work. I really can't hear very well.
I can't either. I can't even hear you guys.
And Brent just walked out.
Okay, I have one idea, so let me try this.
Testing. The mics aren't on.
The mics are wired to the computer so people can hear it.
I'm with you, Jennifer. I thought, is it me? But I cannot hear a thing. I can hear
Yeah, I
you
really
fine.
can't hear. So, yeah, I can hear you too. So,
Okay, so hopefully no motion sickness here. I'm going to move you. Go ahead, doctor. Yeah, I'm going to move the laptop that is the microphone a little bit closer center. So to see if that helps. Now the only thing though is.
Okay, we'll see you then.
Nobody's talking right now.
yeah, now you're far away again.
Okay. How does that sound?
I mean, so I can hear you now.
Okay. Well, we all
Maybe,
can
I don't know. So,
Yeah, go ahead.
I was just going to say, I don't know. There's maybe, never mind. I'll go ahead and hopefully, I'll be able to hear your questions, or maybe somebody can, just go closer to the microphone to ask.
Okay.
So basically, let me just, I'll give you a little bit of my background, and then, I'll just give you a little bit of an overview, and then maybe people can ask specific questions. So I'm an infectious disease specialist. I have over 20 years experience in hospital epidemiology. My area of expertise is in pandemic preparedness. So really, this particular thing that's going on is what I've been preparing for my entire career. I have experience working with the public health department in Cleveland. I was in Cleveland for 26 years before I came to Toledo last year. And so now I'm the chief of division of infectious diseases at University of Toledo, and I'm the medical director for infection prevention at ProMedica. My partners and I have seen almost every patient who's been hospitalized at ProMedica with COVID-19. And so we are, I would say we have a huge amount of clinical experience. And we know a lot about the different issues that people are dealing with when it comes to this infection. So just to give you, kind of a quick overview of what's going on right now, we are definitely seeing a surge in cases again. There was this kind of thought that we would have, a first wave, and then it would decrease, and then we would have a second wave. The first wave never went away. We have had ongoing cases, although, they did go down after people stayed at home. So staying at home definitely had a big effect on the number of people that were being hospitalized. We still had a fair number of people hospitalized through May. And then at the end of May, we saw kind of a decrease, and now things are really starting to go up again. And in fact, we're seeing as many people in Ohio now testing positive every day as we had at our prior peak in April. So we actually are now having more people test positive. And one of the questions that comes up is, is the reason that we're seeing more cases because we're having more testing? And so clearly the testing does impact the number of cases. But the important part is that we are seeing an increased rate of hospitalization again. So for all of the people that have COVID-19, probably only about 10% are going to be sick enough to be hospitalized. The estimates vary a little bit depending on what population you look at. But clearly most of the people are not going to be sick enough to end up in the hospital. But when you see the hospitalizations increasing, that tells you that you're having a big problem going on in the community. And that's where we are right now. So there's a few things that we can do to try to, decrease the number of sick people and the number of people requiring hospitalization. And so there's basic infection control measures, which include wearing masks, using hand hygiene, and then the social distancing that you've all heard about is really important. But I will tell you that it's for some reason, it's really difficult for people to implement this. And even for healthcare workers, I see a lot of people that just don't really seem to understand that we do really mean 6 feet. The further away you are from another person, the lower the risk of acquiring the infection. For schools, this poses a big challenge. I think you probably have one of the most difficult situations, actually more difficult than hospitals, because in a hospital, we have a controlled setting. We can control the people going in and out of the rooms. We can wear personal protective equipment. In a school, you're dealing with children who may be more difficult to get them to pay attention. And then there's going to be some age groups that just are not going to be able to wear masks. So that's a challenge. And we know that, that people use, obviously, school systems. Sometimes kids go to school even if they're a little bit sick because the parents have to go to work. So we know that there's a lot of challenges facing schools. I have to tell you from a personal standpoint, I have 2 children. They are going to be going back to college. I am dealing with some of the same questions, although it's a slightly different setting than in a K through 12. But I fully appreciate the fact that kids have to go back to school. However, it has to be done safely because otherwise you're going to be running into a lot of problems. So I just want to mention a few things. One of the things has been that kids have not gotten sick as often as adults, and there's probably a number of different reasons for that. There's some scientific reasons, like it looks like children less than 10 may have less receptors in the nasal epithelium than adults have that are required for acquiring this infection. But we also know that there have been young children and babies that have gotten infected. So that is certainly not all of the answer. The percentage of people being hospitalized is lower among children than it is among adults, but it's not non-existent. So there are children who have gotten severely ill from this infection. And there's also something called multisystem inflammatory disease, which is basically, it's COVID-19. It's the same thing that we're seeing in adults, but it's just in children. And when they get this, it's very severe. And 80% of the kids that get that will end up in the intensive care unit. And some of those kids will end up on ventilators. So this is a serious illness. And about 73% of the kids that have gotten it have no underlying medical conditions and no identifiable risk factors as to why they should have this. So, the other quick thing to say is that this is going to be with us for a while. And a while, I mean a year or more. Until we have an effective vaccine available for everyone, we are going to be dealing with this problem. So this is something that we are going to have to get good at dealing with. And, new things come up about this constantly. So I would just say right now, the United States is having a really big problem with this because there has unfortunately been debate about basic infection control measures and whether or not they work. And, people are, debating whether or not they have to wear masks and that kind of thing. And there should be no question about that. Masks work, but they're not enough. They're not going to protect people completely. And so even when everybody wears masks, there's still risk. And so people need to be aware of that. And if people are at really high risk for complications, there needs to be some possible modifications, like being able to, work remotely. And for kids that are at really high risk, I would imagine, that some of those kids are going to need access to online classes. So let me kind of stop there and see what your questions are.
Well, I have 2, Doctor. Can you hear me okay, or Tom can translate? Oh, he's bringing you to me. Isn't that sweet? I find this whole process extremely fascinating in that everybody keeps concentrating on this is doom and gloom until we get a vaccine. What about the treatments that we already had with the Zelenko protocol and the Bartlett's protocol? Are we using any of that in the Northwest Ohio?
I'm not sure. I didn't hear which protocols you said, but you asked about treatments. I will tell you what treatments we have. The treatments we have are dexamethasone and there's a drug called remdesivir. The other thing that we have is that we can ask people to lay on their bellies rather than laying on their backs. But I will tell you that when people get sick enough to get hospitalized, which is some percentage of the people, and you don't necessarily know who that's going to be, those people are sick for a long time. So we have people who are in the hospital for 2 to 4 weeks, sometimes longer. Some of those people are going to have lifelong effects from this. And this is not like other viruses that we've dealt with. This is not like influenza. People are getting really sick. And I have to say that as with regards to the treatment, the remdesivir, which is an antiviral medication, we have a little bit of that drug. It's really difficult to manufacture that drug. And that drug, we're going to have enough to treat some very small percentage of the people who are sick enough to be hospitalized. Other than that, we don't have any proven treatments. There's been a lot of discussion about hydroxychloroquine, and there have been tons of studies showing that hydroxychloroquine is actually detrimental and is not effective at treating this. And so, right now we really only have 2 things that work. It's dexamethasone and remdesivir. And then the other thing that I mentioned about having people lay on their bellies, unfortunately, a lot of the people we have who are sick enough to come into the hospital, one of the major underlying risk factors is obesity. And unfortunately, our country has a large percentage of obese people, and people who are morbidly obese have difficulty laying on their stomachs. Even though we know that helps, the people who need to do it the most often can't do it. So I don't know if that answered your question.
I personally
treatment.
I'm sorry. I personally did not hear what you said about laying on your belly. That's something I've not heard before. Could you repeat that quickly for us?
Yeah. So when people are sick enough to be hospitalized, when people lay on their stomachs rather than laying on their backs, they get more oxygen into their lungs.
Oh.
So that's one of the things that we have used that actually helps to prevent people from having to go on a mechanical ventilator. If people are sick enough to be put on a ventilator, once they're put on a ventilator, they're going to be on that ventilator for 2 weeks or more, and a large percentage of those patients are not going to survive. We have seen some really horrible deaths from this disease, and it is, anyone who thinks this is not bad, I don't know what to say other than this is one of the worst things that I've seen as an infectious disease physician, and I regularly see really horrible things. So I just want to emphasize that.
Okay, thank you.
This is Kelly. I have a question. So is it your recommendation that schools open on a hybrid model where you do not have all the children attending at one time?
Yeah.
And how many children in Wood County have been hospitalized?
And so I can't answer that question. I don't have access to the Wood County statistics regarding children. I have access to, hold on, I'm sorry. I do have data that's available on the Centers for Disease Control website that tells you the percentage overall of children that have been hospitalized versus adults, but it's not by county.
Okay, so you don't know how many children gotten sick, gotten in the hospital, or died just in Wood County?
I don't, no.
And the data you look at just specifically looks at COVID, not the mental health aspect, not the emotional aspect, or the benefit of being in school. Is that correct?
No, I didn't say that. There's a balance between being in school and getting sick. And I think that you have to take both into consideration, which is why we're having the discussion about opening school. Because if we were only taking into account COVID, then we wouldn't be having the discussion about opening schools. I think it's incredibly important for kids to go to school. And I do worry about what's going to be happening to kids who are not able to be around their friends. And we know that there are increased rates of depression, et cetera. But you have to look at all of the risks and you can't just look at one isolated thing. So most people are advocating that schools open, but you have to do it safely. And it's not just a matter of looking at deaths in kids or, deaths or how many kids are getting hospitalized. You have to realize that we're all connected. And so if the kids are sick, and if their teacher is someone who has an underlying medical condition that's going to put them at risk for severe disease, then it's not just the kids. So we're all connected. And, everybody lives with people who have potential risk factors for severe disease and for hospitalization. So all of those things have to be taken into consideration. And as I said at the beginning, I don't envy schools. I think this is an incredibly difficult situation. But you have to take this problem seriously, and then you have to put certain steps into place to make sure that what you're doing is safe for everyone, for the teachers, for the students, for their parents, for everyone.
Great, thank you. And then what would be your recommendation on sports then? If we say it's safe to open up 2 days a week, let's say for the secondary kids that do play sports, would your recommendation, if you cannot social distance in your contact sport, would your recommendation be to not have that sport?
I think
No
it depends
mask,
on
no social distancing?
Yeah, I think contact sports, we know that there's potential for people to get sick. So, I think that is going to be a difficult question. And we know that there have been outbreaks associated with sports. And that's one of the reasons that some professional sports teams have decided, not to have sports. So, I think that's going to require discussion.
And then lastly, one more question. Would your recommendation be for masks for schools, all children?
I would try to mask as many as possible. I think for very young children, it may be difficult to do that. So I understand that, but as much as possible, if you can get kids to understand and wear the mask, that would be the best situation.
Correct, I agree. Thank you very much.
Sure. And let me just mention something quickly. One of the things that I keep seeing, and I don't know why this is, but I keep seeing people who, the masks are uncomfortable. There's no question about that. And, they're difficult to speak with. And so a lot of people will pull down the mask when they're speaking, or they don't completely cover their nose and their mouth. The mask should cover the nose and the mouth. And especially when people are speaking, it's important to keep the mask on because that's when people are aerosolizing particles into the air. So it's important that, they leave them on when they're speaking.
Doctor, I have a question. It's Gretchen Downs. And people often say, well, Europe is opening their schools and they're doing fine. Could you explain how they gradually did open the schools? Do you have any information on that? Why is it safe for children in Germany to go to school, but not in Toledo?
So, I think I don't have all of the information about what's going on in Europe. I know some of the information and I have relatives in Europe. So I can tell you, and I'll tell you, I have relatives in Switzerland. Switzerland and Germany are fairly similar in terms of their case rates and their school system. There's a lot of people getting sick there. And, when you have people in any congregate setting, you're going to have outbreaks. I mean, that's just the way it is. And there's lots of papers that you can look at, and it shows you, depending on the size of the gathering, you have different risks of outbreaks. And when you have people in any kind of congregate setting that's inside, so nursing homes, prisons, I'm not equating schools to prisons, by the way. I want to be very clear about that. That's the fact that you're inside. That's the only comparison that I'm making. I want to be very clear. I love schools. So, but, ships, cruise ships and that kind of thing, there's an increased risk. The more people you have, the more outbreaks that you're going to have. And so in Germany and in Europe, my understanding is that people have gone back, but they are, their testing capacity may be greater than ours is right now. We still don't have the capacity to test absolutely everybody. So, you know, we are still not able to test people, for example, who are not sick enough to be hospitalized. You know, those people are going sometimes to CVS or to Walmart or to one of those places, and they may not find out their test results for 5 to 7 days. So different countries have different testing capacity. If you can test someone and know that they're positive, then that person and their family is going to be staying home, hopefully, and you know that will limit the spread. But if you're not able to test everyone who has mild symptoms, then it's going to be more difficult to convince those people that they actually need to be at home. But I will tell you that from what I know from my relatives, people are getting there's a lot of people getting sick in Europe.
Thank you.
Hello, Dr. Ray Pullman. My question is to you is why is that in your expertise, 20 years experience dealing with infectious diseases, why do I hear people keep telling me that when we reopen schools, we're not going to have problems because kids won't get infected? Why is that mindset out there in the community?
Because, you know, people don't want to believe reality. And I honestly, it's a mystery to me. It's the same thing, you know, people are saying that they don't believe in masks. I had a guy in the hospital recently who had multiple risk factors for severe infection. And he told me that he didn't believe in COVID and that he thought it was all overblown. I've had healthcare workers tell me that they think it's overblown. These are people who have not seen the severe illness, and they just don't understand what happens to someone when they get this. And I can tell you, I've had, you know, people who were previously healthy who've gotten really sick and ended up in the hospital for weeks. It's a devastating illness, and we've had you know, families where more than one person in the family died from this, which is really horrible. So why don't people believe this? I don't know. I mean, there are, you know, people sometimes just believe what they want to believe, and I think that's something we're clearly seeing here.
So what I'm hearing,
I think the thing. Sorry, I'm sorry for interrupting. Go ahead.
no, I'm gonna say, so what I'm hearing is our adolescents, our high school, junior high school student, greater than 10 years old, they're not in a bubble. They could get COVID, correct?
Absolutely.
Okay.
And in fact, you know, young people are what is driving the current surge right now, because, you know, we have people that are attending parties and that don't think that it's a big deal, and they figure even if I get sick, you know, it's not going to be that bad. But, you know, they don't necessarily think about other people around them. So it's not just them. You know, their parents might get sick and die. And we've seen that. And, you know, we know that, you know, young people also can get sick and hospitalized. But, you know, we know that as people get older, the risk is greater. So, again, everybody's connected to everybody else. Nobody is living isolated, you know, in a bubble. And so it's not just the person themselves that they have to worry about, it's everyone around them.
Thank you very much. Appreciate that.
I've got one more question. This is Kelly. Is the statistic still true that 80% of the people have mild symptoms and will not get severely sick?
So,
Because I know friends
exactly. Okay. Sorry. I was just going to say, you know, the statistics are based on who you can test, okay? And so depending on the population, you're going to get, you know, somewhat different numbers. Overall, I would say most likely 80 to 90% of the people who are being infected are not sick enough to require hospitalization, okay? But of those who do require hospitalization, it's a bad illness. So those people are pretty sick. And some of those people have symptoms that go on for a long time. I will tell you, I took care of a nurse who doesn't have any underlying medical problem. And she came up to me recently. She had been in the hospital. She was sick for a total of about 4 weeks. And then she ended up losing all of her hair. And she said that even now, 2 months later, she is not back to normal yet. She's still severely fatigued. She doesn't have exercise stamina like she had before. I mean, so there's some lingering effects that are not being well described yet. And we know about these things because, we're still seeing people coming back into the hospital, sometimes with complications from their, they survived the initial time, but then they have some complications. So, you can say that overall, most likely people are not going to get that sick, but when you look at the numbers on a large scale population basis, we are dealing with a huge number of sick people. And again, you don't know if that person is going to be you or someone in your family, or if it's going to be, or if you're going to get lucky. I've seen a lot of sick people. So what I was going to say earlier, the thing I would be concentrating on, if I were in charge of, if I were having, your decision is that you have to do it in the safest way possible. And so, you have to evaluate your spaces and figure out how many people can safely be in that room and whether you have teachers who maybe should not be coming into the school. Maybe you have people who have severe underlying medical problems that are going to lead them to increased risk, who maybe should not be doing inpatient teaching at this point, or in-person teaching at this point in time. Or, maybe you decide that, you're going to limit your classrooms to X number of people and you're not going to be switching, teachers. Like for when I was in high school, we had a different teacher for every class period. You may need to think about not doing those types of things in order to decrease the interaction.
Well, Doctor, that kind of leads into the question I have, and I have the advantage and the disadvantage of being the last one to ask questions here. But so thank you for the thoughts on what we need to think about. If I can put you on the spot here and say, if you were a decision maker for a school district, how would you rate? Well, how good of an idea, how bad of an idea is it to go back full 5 days or 4 days? What's your thoughts on that?
I think full time, I don't think is a good idea. I think that, having a reduced class size or, like staggered, maybe staggered classrooms is a better idea. I think if you put everybody back in, you're really asking for trouble. I think it's just not really an option.
Thank you for that. And then this question may be somewhat unfair, but from what you're seeing in the community, be it Lucas or whatever, even at the state level, how do you rate our chances of controlling this, or are we headed towards, as the governor says, another Florida, another California? Where do you see this? Where do you see us being in about a month?
Yeah, if we keep going the way we are right now, we're going to be in big trouble pretty quickly. I have to tell you that, especially over the last couple of days, there's been a huge increase in hospitalizations, and I think we are definitely, we need to take measures to decrease the spread. I'm not in favor of shutting everything down again. I don't think that's economically viable, and also there's all kinds of problems with supplies for testing if we shut everything down. So it doesn't help to do that. It helps, to shut some things down, but I think we need to be thoughtful in the way that we do this. And, I would just really try to think about how you can decrease the number of people who are in a specific setting. One of the things you should be thinking about is, what are you going to do when one of your teachers ends up in the intensive care unit? Because it's likely that may happen, okay? And if that happens, how is your community going to respond? I would start thinking about, what are you going to do if a kid gets sick and is in the hospital and is in the intensive care unit? What are you going to be doing if teachers are getting sick? Those things are likely to happen. And so I would start to prepare for those kind of scenarios and plan, think about what your potential response is going to be.
Thank you for that. Thank you for your time tonight and your expertise.
Yeah, thank you. Thank you.
Doctor, one more
And
question.
by the way, yeah, I was just going to say, I'm sorry to be sounding so doom and gloom. What I want you to take from what I'm saying is that there are things we can do to decrease the risk to people. And if we do those things, then I think we can be more safe about it. I'm definitely not saying not to have school, but I just think we need to be prepared for, what can happen.
Yeah, point well taken.
This is Kelly again. Do you know what the percentage of children that actually get it is? Let's say 18
Again,
and under.
No, so the answer is no, because we're not testing that population. So unless you're actually testing everyone, there's no way that you can know what percentage of people are getting sick. And so right now, because of the way that tests are available, there's been a shortage of nasopharyngeal swabs, which are the swabs you use to put in the nose to get the test. That's the most accurate test. There's nasal swabs. There's the liquid that the swab has to go into to be transported to the lab. There's been a shortage of that. There's been a shortage of the swabs. And so because of that, we have to actually decide who the priority groups are for testing. And so the priority groups for testing in Ohio right now are people who are sick enough to be hospitalized. And so the reason that we're testing those people is because we obviously want to know whether or not they need to be on certain medications and also what kind of isolation precautions they need when they're in the hospital. We're testing healthcare workers who are having symptoms so that we don't have people coming to work if if they have the illness. We're testing first responders for the same reason. And then, the next priority group is people who are going to be undergoing medical procedures, people who live in long-term care facilities, people who are going to be having chemotherapy, those types of things. And then, if you look at the 5 tiers in Ohio, the last group is everyone who's, asymptomatic. And until you have enough supplies to be able to test all of those people, you cannot give with confidence any idea of the numbers in all of those different populations. And there has not been any large-scale testing of children to date, so nobody can tell you that, it's X percentage in children. We know about the percentage who are getting hospitalized, and that's the only number that we know.
And that's pretty low, is that right? Is that a correct statement?
It's relatively low compared to adults.
And do you know, I remember from the beginning, I think it was 70 to 80% of us are going to get COVID. Is that, I haven't checked it in a long time, but I remember seeing that right when COVID came out, they said that. Is that still an accurate statement? Or what's the percentage that you guys now think will get the disease, virus?
It depends. It depends entirely on what kind of measures are put into place to stop the spread of illness. So if we were to shut everything back down again and make everyone stay at home, then you could stop people from getting this. So it really is dependent on what kind of control measures are in place. It depends on how many testing supplies are in place, and it also depends on when we get vaccine. So, if this goes on unchecked and people keep getting sick, then it's likely that 70, 80% and even higher are eventually going to get it. But again, it really depends on what kind of control measures are put in place and when vaccine becomes available.
All right, Doctor, thank you very much for taking the time to share some insights. I think it's very worthwhile for us and certainly our community to hear an expert's perspective on this issue. And certainly we can respect the fact that, things are evolving and we have to be very flexible with the information that we're learning about this illness and what can we do to better protect our students and staff and families. So we're very grateful for the time that you've taken and your continued outreach to other educators to help in this process, because while we may be experts in certain areas in designing and operating schools, this is one that I think we can agree that we're a little bit out of our element. So we're grateful that people like you are there to provide that kind of help and guidance for us. So thank you for what you do. And
Thank you.
we hope you be safe as well. I hope you're safe.
Tom, I
Yeah.
can't even tell who's speaking. It's very, very hard to hear. Could you hear anything, Jennifer?
No, I couldn't hear.
Unless you guys have the microphone, we cannot hear anything.
Yeah. Just, Eric, maybe just pass along. Just thank you very much for all that. Yeah. So.
Again, Doctor, thank you very much for your time tonight. It's appreciated. We're certainly not experts in this, when it comes to the infectious disease side of it. So your viewpoints are valuable. You be safe as well, and thank you for what you're doing for our community.
Thank you.
All right. Okay, thank you. And if she, I know she's very busy and we've taken a lot of time, so I know that she needs to jump off, so that's good for us. All right. With that, we'll move on to the second part of the superintendent's report. And can we just do a quick sound check before we get too far? With Kelly, can you hear us?
Can you hear us, Kelly?
You hear us, Kelly? Kelly? Kelly, can you hear us?
Okay. Yeah. Yeah. All right. Yeah. And we appreciate. We are doing the best. We have a board member that is remote, and the rest are here, so it creates a little bit of a technical challenge that is stretching our capabilities, which is a good thing, except not when you're trying to convey really important information. So I know that what's going out is being heard and connected well, and we just have to make sure that we keep a connection with Kelly at that remote location so that she can hear. So we'll do some checks to make sure that we haven't lost that connection. So with that, we wanted to begin with our presentation of reopening the schools facility 2020-2021 for this upcoming school year. And Brooke Price, Assistant Superintendent, is also on the line and will jump in from time to time as we get into some of the more details of the presentation. So we wanted to begin with just what you've heard, and you've heard now the Wood County Health Director, Ben Beatty, who joined us, Dr. Hanrahan, who just said the same thing that's up on the screen, which is we want students to return every day. And that is a consistent theme, and I think it's important that we have this be the very first slide that we're showing, because we understand that's important, and we don't want to minimize that at all. But we also understand that students have that real tangible concerns when they're not in school. And we have a team here, Dr. Glesser, we have 6 school psychologists that we hear from that group regularly about what we need to do. We're also fortunate to have 13 school counselors here in the high school or here in the school district that are, again, continuing to offer guidance in terms of what can we do to make sure that when students return that we're meeting those needs, because that is really essential to what we're doing. So while we're focusing on the virus and the spread and all the things, it's important to know that this is our second slide, because this is an important component of the reason we're bringing students back and we're taking the steps to bring students back, but also it's all hands on deck. And we're fortunate to have outstanding staff, especially in this area, who are skilled at identifying and responding and will really be indispensable in their efforts to make this happen. But then our next slide, and we just heard a great presentation talking about the fact that COVID-19 is a significant issue, not only within our school community, but also throughout our community and throughout the state and country and world. So what is our role as a school district in trying to protect our students, their families, our staff? And also, we talked about this on Friday, the reason, the why, and that is we need to make sure that we're doing our part together with all the other community institutions and organizations that are trying to make a difference. We have a role in that as well. So the process that we have on Friday, the July 17th, we talked about the why. Why are we making this recommendation today? Today, we're talking about the what. What is the recommendation that we're making? What are the details, the general details that we're providing? And if the board supports this measure, tomorrow we'll begin to talk about the how with our staff. And I think throughout the process, there's been a great deal of feedback. And the board here has challenged us to communicate often and frequently with the board and the schools and in the community in general. So back in May, we began to talk about the 3 doors. Remember, it sounds like a lifetime ago, but the 3 doors in terms of which door are we preparing for as we look at this upcoming school year. And then we came back a month later and we talked about the hybrid model and what we could tell from that. And it only wasn't until July 2nd that we got guidance from the state of Ohio, which was really pure guidance that allowed us to pursue the path that this board feels is in the best interest of the students and the community and the staff. So, moving forward, those employee voices are going to become more and more important. Feedback from parents is going to be more and more important. I was a classroom teacher for many years. I've been a superintendent for 20 years. I would not begin to understand or begin to know what teachers need today in that classroom to be most effective. Fortunately, we have outstanding teachers who can give us that information. And this next phase of that how, that is really where their voice is going to be essential to our success. Because we don't have it figured out in terms of how it's going to work in that particular classroom with that particular subject matter. And that's where our experts, our teachers, our staff are going to have to weigh in. And that's really been our, approach. We know that there's many questions with families, staff, students, and to answer the question of how. And we've prepared a detailed guide for families that'll be released later this week. And it's our Welcome Back, the Back to School Guide for Families. And in this, we are collecting all the different questions and things from the health department and from our operations that families and staff just need to know to start the year off. And this is going to be a snapshot in time because once we get into the school year, there's going to be more questions that we haven't even thought of that are going to be asked. But we want you to know and families to know that the questions that are starting to come in the waves of emails that we're getting, the answers are going to be coming in the next several days and the next several weeks. And every once in a while we get those questions. It's like, we haven't thought of that question. Thank you for bringing it to our attention. We're going to work on that. And there's lots of those out there too. And I think the underlying thing that we need is we have to be flexible. And we heard that again on Friday with Mr. Beatty, who's the Wood County Health Director, saying, we have to be flexible. And today with the doctor, I think we can all agree that the message was, you've got to balance things with school and we're learning more about this virus and we're going to have to be flexible with what we're doing in our approach and be responsive. So I think that's the key word in terms of all that we do. And we've learned a great deal about, online learning and all the things here and the pictures that you see here, the students in those settings. We had some great successes and we had some experiences that were less than successful. And we know not every student thrives in that environment. And we know some families have significant barriers with doing a full remote. And it's that balance, it's threading that needle that we have to find a way to come back to school in a way that protects as many as we can. So talking about that, we have begun to outline, again, we're talking about the what. What are we going to do to keep students and families and staff safe? So the next series of slides are just an outline of some of these things. We have to come up with procedures for contact tracing. The day began today with us sending letters out to families about a positive test result for a student, letting them know on behalf of the health department, here's what has to happen. We spent the weekend communicating with different staff members who are on quarantine for different reasons. This is the new reality, and we have to have a procedure in terms of how we handle that. And so we're building that as we speak right now. And fortunately, we've got great relationships with the county and other medical professionals who are guiding us along that way. But when you think about what we have to do, there is virtually every aspect of school changes. Because when we get that phone call on Tuesday night at 7 o'clock saying, this person is a suspected positive, and we're waiting the test results, we then have to pull what bus stop they attended, or what bus stop were they on that morning, and what students were with them on the bus, where were they seated, who were the other passengers on the bus, what classroom were they in, where were they seated in the classroom. All of these things, we have to begin to collect that data and have it available and ready to communicate to families. So we know that the procedures when symptoms are happening, we've been talking at great lengths about what happens if during the day a student comes down with symptoms. We're going to have a COVID room in each one of our buildings, and we're working on that location and what that has to do, and the protocol to monitor that student, to contact their family, and to make sure that they understand what's happening. And we talked about, and there were some great questions earlier about masks. And again, that flexibility, that balance that we've been really building our plan around is centered around, and in student grades 3 through 12, students are going to have to wear a mask. In the classroom, all students will have to wear a mask on a bus, but in grades K through 2, students will not be required to wear a mask. And that's, again, we're trying to find that balance and be required, will be required with, on the bus, and the masks that we'll keep in different classrooms will be certainly, something that we've been working through.
Tom, could
yeah.
I ask a question? I never like to interrupt when you're on something, but something didn't compute. You said that K through, and I just wrote it down, K through 2 are not required to wear masks, but down in the bottom paragraph there, you're saying that they do have to wear something. So are they going to be wearing one, or are they not going to be wearing one?
Let me back up there. Yeah.
Yeah, all students in 3rd grade through 12th grade will need a cloth mask. Students in kindergarten through 2nd grade, they will need a cloth mask in any common high traffic areas. But once they're in the classroom, the district's going to provide a face shield, so the student could wear the face shield while in the classroom if they do not want to wear the mask all the time. K2 is still going to have a face covering on throughout the day. They will have the option to wear a face shield, which may be a little easier to have on throughout the day for younger kids, a little more sanitary for our younger students. So face coverings are going to be required throughout, but kindergarten through 2nd will have the option for a face shield within the classroom.
Are we going to wait for the presentation to be over to ask questions?
Yes, I would suggest that we do that.
Yes,
Yeah.
and that's why I
No, that's
apologize,
a
but
good
there was a
clarification.
conflict there in what he
Yeah,
said, and I
yeah.
wanted to get that straightened right away.
Yeah, no, I appreciate that.
Sorry.
Yeah.
Did somebody hear my question?
Yes, we did hear
And
it.
we just
We're going to
answered
we're going to wait until the presentation is complete.
Yes.
Yes, Kelly, we're going to wait till the presentation is complete, and we'll ask questions.
So social distance,
So I just was gonna take notes. I can't see it from here.
There are no page numbers.
we're on slide number 10. So if you can access it on the website, it's available to anyone who's watching. And
Okay, I got it. Good. Thank you.
So on slide 10, social distancing in common areas, arrival dismissal. So when we heard folks talk about the congregation of where people gather, trying to reduce that, that's what we're going to try to do, is make sure that folks are in masks in those common areas. Sensory rooms are scheduled as possible, limit one student at a time. And those are rooms that service our students on IEPs. Also, we've learned that holding meetings virtually when everyone is in a virtual meeting, there's been some success with that. So when we talk about parents having to take a day off to come into the office to meet with a teacher or principal or counselor or for an IEP, we've understood that we actually can have meetings virtually. And I think that's one of the benefits of being in this situation is we've been able to see in certain areas, which is going to be much more convenient to families. But also that's something right now that we're going to do that as much as we can. So during the school day, instead of having parents enter the building, we will arrange to have a meeting virtually. But within the buildings, obviously staff will be present and engaged with each other. We're going to stagger transitions in the younger grades as much as possible. And of course, no large school assemblies. So when you think about a pep rally at the end of a Friday night or Friday, before a game, obviously, we can't have that kind of environment. Also, large school assemblies, when we talk about lunches and how we're going to serve lunches, that's another area where there's a large gathering of folks. So we've been looking at our school day and trying to break it up as much as we can. So we've modified arrival dismissals as much as we can, different entrances. Sharing, and this is one of those things that the staff is going to come up with plans for each classroom in terms of how do we limit the sharing of items between students as much as we can. Students with disabilities, teachers requiring interventions with students, gifted and necessary are necessary. We're going to continue to look at how we can provide those in a blended format to the best of our ability. We know that we welcome visitors and volunteers on a regular basis. People look forward to that. Moving forward, that's not something that we're going to be able to do. Again, just to keep the limit and exposure to a minimum, and folks that want to come in and do those kinds of things, we're not going to be doing that. As students use the locker room, remember in high school, junior high, everyone goes to the lockers at the same time. There's mass chaos. We're going to be staggering how those things are going to be happening. And of course, at the secondary level, we'll have fewer students, which will also reduce that traffic and that congregation. Additional safety measures, we're in the process of purchasing PPE. In March, we boxed up materials from all of our buildings and sent them to hospitals. And now we've been working on getting those things back when available and ordering additional. So we've been part of some consortiums in terms of what we're able to provide. But we understand that each teacher, each staff member will be provided a mask, cloth mask, and a face shield. So that's something that is important to us as we move forward in some of those basic things. Our drivers are going to be wearing N95 masks because obviously face shields is an entirely different situation in terms of obstructing vision. So that's something that our drivers will be asked to do. We were a part of a couple different conferences with, putting up plexiglass around drivers. There's all kinds of rules and regulations as to how you can modify a school bus for lots of reasons. I know there's been some changes with that, but keeping the seat behind the drivers vacated, again, trying to create a physical barrier as much as we can while on the bus. We know that we're going to have sanitizer hand washing stations. That's going to have to be part of our regular routine. students washing hands, staff washing hands. We know that we have electrostatic spray machines for each building, that kind of wand that goes through, and we can cover a lot of material and sanitize it. And that's very effective in controlling, maintaining the spread. But we know that this year, with the successful passage of the levy, we did add 2 school aides or nurses to our elementary. So now each of our buildings has 1 designated school nurse. So that's a great addition for us to have. The other thing that we're working on right now is we don't have an exact name, but a COVID tracker. That description that I just gave you about the process of getting the phone call on a Tuesday night, beginning to pull class lists, communicating with the health department, communicating with families, tracking when students will be able to return or staff. Who is responsible for that? Especially when you get into a situation where you might have a student, let's say that one sibling is at Woodland and the other is at the junior high. And how do those buildings coordinate and provide that kind of information and follow-up? So that is something that we're looking to add. We have a job description. We had a personnel committee meeting today talking about that kind of a role here in the district. We've also learned from other private and public sectors and business institutions, that what can we do better? What is effective? We hear those things all the time, and things that we can glean from our partners, we're going to do that. We don't want to pretend that we have all the answers, but we want people to know that, again, that flexibility, that if we see something, hear something that somewhere else, something else is taking place, we're going to look at adopting that. We need the best practices in terms of our approach to keeping students safe. Again, we have to be flexible. And we also have to hear from families and staff and students. What is working? What can we change to make it a better learning environment for them? Because we have to keep that in mind with everything that we do. While it is all about safety, and right now we're in that portion where we're talking significantly about the safety, we still want school to be an experience that kids are looking forward to, that they want to enjoy, that they're getting something from. And that's a big part of our conversation as well. So I don't want folks to think we're only focusing on just that preventative and safety measures, but the school experience is something we've been talking about significantly, and making sure that we have that experience for all of our students. We know that the Jacket Way, Crisis Way teams will be working to address the social emotional needs, and I addressed that very early in the presentation. This is something that's really important to us. We'll involve the mental health of all of our students, professional development, and talking about trauma with our staff, and what to do is we have students that we haven't seen in a great deal of time that'll be returning to us. So we have to be prepared for them, to meet them where they are. And then support families as they continue to have needs. And that supporting process is obviously going to be very important to us. So now I'm going to start moving into the different hybrid learning models. Risk versus benefit. So one of the things that we've heard from health, any conversation I've had with public health and doctors, is the safest thing to do is to keep kids home. Everyone agrees that is the best thing that you can do to stop the spread, to do all the things you can do. And there are schools across Ohio that are going to do just that for a variety of reasons. And I think our conversation has been that risk and benefits. It's taking that the importance of getting kids back into school and learning. And I think our plan is structured in a way that allows us to spend the most amount of time on the students who need that experience the most. And then weighing that against the risk of this disease and of this illness and what it can do. So I think that risk versus benefits, and there are legitimate questions that we get where people will say, if you're doing this or you're not doing this, then why are you doing this? And those are legitimate questions, and the answers aren't always easy. And we'll talk about this recommendation, but an example is putting 2 students on a bus together, both in masks, transporting them to school. The benefit is we can get more students safely to school. The risk is now you've put students in that small bubble for a period of time inside that 6 foot social distancing recommendation. And that's one of those things that we have to find that healthy balance. And it's not to say that we might not come back and say, we're going to have to make an adjustment. This is an issue. We've had issues here. But we're starting in this position, a defensive position, where we can become more flexible as we have to moving forward. So that risk first benefit, the ability to trace and minimize disruptions, and we'll talk about that. We talked about it Friday. The flexibility of the different delivery models will have to change throughout the year depending on that student's situation. And collective effort, we just have to try to slow the spread in our community. So one of the first things that comes up is why maintain a remote learning day and 4-day to 1 in-person week. So we talked a little bit about this last time, but our teachers have to be prepared for a variety of situations. Again, that word, flexibility. They're going to have to be prepared to deliver face-to-face instruction. So in grades K through 6, face-to-face every day, 4 days a week in those pods where the students, we're reducing the risk by keeping the students together. But at any given time, we can get that phone call on Tuesday. The phone call that says, we were at a wedding this weekend and now, we have to quarantine. Not showing any symptoms, but have to quarantine for 14 days. We have to have a teacher be prepared to have the time to be able to support that student because they're going to return in 14 days. So how do we do that? And how do we limit that spread? So even in the K through 6 environment, that's an important factor to prepare for that. We also understand that that maintain a day of remote instruction allows for improvement in learning and limit the disruptive nature as we talk about what happens at the secondary level, just with more bodies, more risk for exposure, and with that comes a greater risk of disruption. But we also know that at the high school, this is an example we use. If we have 5 students with 6 different teachers test positive, the number of students that would have to quarantine would be 780, and that doesn't include clubs and lunch tables, study halls. That's 46% of our student body. That could be out for 2 weeks. That's a significant disruption to those students, to those classrooms. So by doing the hybrid model that we're proposing, instead of 780 students potentially being quarantined, it's actually 390. It's still a lot of students. That's a lot of disruption, but it's not half the school. So this does allow us to have that flexibility to maintain the learning process the best that we can. The question of why Mondays have come up. And when we looked at this, there are fewer Mondays than any other days of the week. So why is that important to us? That's important to us because we want students to be in school as much as we can in the hybrid model or in any model. But if we were to select a different day, for example, Wednesdays and Thursdays with 37 days, now we're losing instructional days, and everyone agrees that's important. There's also talking to our elementary teachers and staff, the feel that we need to have students back to back on those consecutive days at the elementary level is really important to develop those routines and those habits. Having a disruption in the middle, if you've taught in elementary, you know, or you've heard about just that restart, that day of bringing everybody back and starting over. So we heard that loud and clear from our elementary. And at the high school level, the junior high level, we heard the same kind of thing where they like the idea of seeing students every other day instead of back-to-back days. And I think, that's one of those things that we have to listen to the staff when they give us that kind of feedback. We also know that that there might be other districts in Northwest Ohio that are also using the Monday remote. And again, the reason why is those national holidays and other holidays fall on Mondays, and that lowers it not only for us, but for other districts as well. It also allows that 2 days of nobody coming into the building, hundreds of kids going through classrooms, touching doorknobs and all those things. Families that need to come in to have access to school that might be medically fragile or otherwise will have maybe more comfort with coming in on a Monday than say a Monday or a Wednesday or a Thursday, when just 12 hours earlier, there were hundreds of kids. As much as we would like, we would not be able to sanitize in those 12 hours, 16 hours. But having the building shut down for 2 days, we know that that is a strong consideration. So when we talk about the public health advisory system, as of the 16th, we have more counties that are moving in red. The conversation this morning with the Wood County Health Department was, we understand you're dealing with one student athlete right now, and here's what we'd like you to do. However, we're moving on. We've had 50 other, cases this weekend. And we heard the doctor today said she has seen a spike too. So that's the reality of where we are. So this is, seriously, moving in directions that aren't necessarily very good. So the basics of this plan: level 1, all K-12 students 4 days a week with remote learning on Mondays. And this does mean that there will be materials and things that those students are going to be responsible for on that Monday. It is not a 4-day school week. There are expectations, and that's one of the things that we get into the how that's going to happen between now and the start of the year, that staff is going to be articulating very carefully what is the rigor, what are the expectations that we have for our students on those days, K-12. So this is not a day off, this is a learning day. And materials will be set for that. Under levels 2 and 3, K-6, 4 days a week with remote learning on Monday. So there's no change between levels 1, 2, and 3 in grades K through 6. For more than 50% of our students will be in that setting, which again, we were able to do that because we're able to cluster to encapsulate those students. And again, those are the students that need more daily contact, that are less independent learners. And then in levels 2 and 3, we have students in 7 through 12, 2 days a week, 60% remote, 40 days in person. And we'll talk a little bit about that. And then level 4 would be certainly something very significant is happening with infections, and we would have to go full remote. This doesn't mean that at any given time, and Ben said this on Friday, at any given time, we may have an outbreak in a school building. And he may say, we need to shut that building down for 3 weeks. Just shut it down. That could happen. And the rest of our buildings still could be open. It's also very likely that we may be coming to the board and saying, we've had enough of an outbreak, enough of a disruption that we can't continue. We don't have enough subs, or this percentage of our teachers are out, missing. That could happen. So again, we need to be flexible with how we're beginning that year to try to limit those things from happening, but there is a possibility that that could happen. So as schools move between these different levels, we want to make adjustments as soon as possible. That would result in us having to notify families and staff, like, okay, we're making a change. Here's the day this is going to happen. So I think that's really important to us as we look at this, is if it comes out on Tuesday, that doesn't necessarily mean on Wednesday everything changes. We will work with families in terms of that kind of planning that has to take place. And so a closer look, level 1, the virus is present. More students can be in attendance at the same time. Level 2 and 3, there's more virus present, in the area, greater risk for community spread. So again, we're trying to reduce that for all the reasons we've talked about. And then level 4 is that extreme exposure. All of this is leading to what we hope that someday we can get back to normal. It's what we all want. And that's what we're all driving towards. But that just isn't possible today. There isn't any aspect of our life right now that you can go into a restaurant or a place of worship or a store where everything is normal. So to expect schools to somehow be normal is just not realistic. And we know that people feel very strongly that we should, in fact, do just that. But if the county remains in level 1 and there's no or few students that anything is happening to, we can look at making changes. And we can look at that. The board does not lose the right by supporting this plan to come back in 3 months and say, you know what? Why why don't we do this? We've had so few outbreaks. We've had nothing happening. People are doing the right things. Let's revisit this, Tom. And we'd be happy to do that. So you don't relinquish your authority. All you're doing is setting up guidelines saying, here is the plan. This is how we're beginning to move. And again, it's that word, flexibility, being flexible. This is how we're starting. It's not how we're going to end, and it doesn't have to be how we have to move. But we do have to rely on information coming from somewhere to make these informed decisions. But that's our goal. So preschool is something that is a little bit of a challenge. So the Ohio Department of Jobs and Family Services actually oversee our preschool program. So it is part of the Perrysburg schools, but the rules that we have to follow are actually given to us by the Ohio Department of Jobs and Family Services. So they've come out with their plan fairly early because they oversee preschool and daycares. And they basically have said 8 children in the classroom. That's all you can do. So they've taken it out of our hands at that level. Now we have a preschool program because we serve students who have different needs that are unique. So students who are on IEPs. And we have to keep a balance between what they call typical students and then these other students that we're really excited to have. And so that is something that we have where 8 children will attend on Tuesday, Thursday, 8 on Wednesday, Friday, home activities and goals and objectives on Mondays. So that follows a very prescriptive plan that we have to do. So there's no wiggle room on this component, this recommendation. We have talked to our legislators about if it is a K-12 preschool, would there be any ability to allow us to basically have that operation fall under our umbrella? So whatever we're doing in our elementary schools, we can apply that to our preschool that we're operating as a school. And we're hoping to get some feedback where maybe they would make that exemption for us or exception for us, but that hasn't happened. And I don't know what the likelihood of that happening would be, but it is something that we're trying to do. So continuing with preschool, divided between providing virtual services, implementing play-based assessments with children. There's a lot of things that are going on with evaluating students and giving them those fine motor activities that they enjoy, and following hand washing, sanitizing. And for those families that pay tuition to attend, the typical students, obviously that it would be prorated to reflect the reduced time than what they're getting now. So here's a sample of the preschool student schedule, where you can see there's groups, how they would flip. The next, I wanted to get into transportation. There's been lots of conversations about transportation, and it really drives what we can and can't do, and I mean that as a pun, because it does. And we were really wringing our hands while we were working on the 3 doors presentation and then coming back with the hybrid, because so much of it has to do with how many students can we actually physically get to school. And that's a real challenge for us. So what we're looking at is bringing in students in grades K through 8, students who live within, generally speaking, a 2-mile radius, 2 to a seat, will be provided district transportation. Those that will be, and we will have a number of students that walk, or I'm sorry, who were riding school bus last year who are now going to be walking to school. And the reason being is we've had to expand that walk area to provide, to utilize all the buses we can, because we have more need for riders than we do buses. In this scenario with this limited seating capacity. Unfortunately, in grades 9 through 12, the Ohio Revised Code does not require that students in grades 9 through 12 be bused. And for us to be able to bring students in K-8 to school, 2 to a seat, which again significantly reduces our ability to transport students, we have to repurpose all of those high school buses. They're now going to be bringing in elementary and junior high, Help Hurry students. The law in Ohio also is interesting, where we have to provide transportation to private school and charter school students that reside in our district within a 30-minute radius, if it's deemed practical. We are still evaluating what that means. So we know St. Rose, for example, they're a large number of families we serve. If we're providing transportation to our students, we will provide transportation to their students. They will see changes with their walk area, just like our regular students as well. At the secondary level, we bus students to the Catholic high schools, for example. If we're not busing our students, we do not have to bus their students. And frankly, we don't have the buses and drivers to do that. So there will be some more information coming out on that. We do not have the boundaries right now of who's walking, who's busing. So people that may be sending emails tonight, where do I stand? We don't have that information. We will be sending out information to families this week, asking them to register for transportation. So we have 4 buses that pull into Frank Elementary last year every morning. Between 70 and 80 students were on those 4 buses. And now, how many buses with this scenario, 2 to a seat, when we're talking about 52 passenger maximum or less, 50 passengers, we need extra buses to make that work. And why we're asking parents to register is if we're sticking to 2 to a seat, and Susie has not ridden all year, and then all of a sudden one morning she's waving the bus down, it creates a little bit of a challenge for us because we have a limit of 2 seats per rider. So we have to take into account those situations that may or may not happen, or changes that are going to happen. So this is really a really daunting task that we're now just beginning to move through. And we've been kind of chipping away at it, but tonight we need that final direction to say, yes, this is the plan. And we'll continue to do that. The other thing is 2 miles. I know some people have said it's 2 miles across the board, and it's not. There are some roads, there are some areas that will be less than 2 miles, but transportation will deem those to be very hazardous crossings for students. And I know there's some families that are going to say, why is this one different than that one? And we'll come up with the guidelines. But at the end of the day, we can't bus everyone, and there will be some areas that we know in advance that are really challenging for students to navigate. And we're going to do the best we can to make sure that we have transportation for that. And we understand that there are going to be considerable disruption to high schoolers, because not everybody gets a ride to school very easily. And I apologize in advance to everybody in the area who are going to be around the high school at drop off and pickup, because the amount of traffic will be significant. The good thing is it's 50%. So it's not all the families at the same time, but that will see increased traffic. So once on the bus, we'll have assigned seating cohorts. So we'll try to have the students in the same homeroom and cohorts sit together as much as we can. Again, keeping those students encapsulated. We're going to have tape showing where students are to sit, trying to keep them separated as much as possible. We're going to do, as I mentioned, drivers and N95 masks, and also trying to keep a 6 feet buffer from the students that are seated around the driver, behind the driver. And adults who don't need to be on the bus, we're not going to have those folks on the bus. And we don't have many instances of that. We're going to have the windows open as much as possible. That's one thing that we've heard is, opening up the windows and that fresh air. And again, we're beginning the process of registering who needs to ride a bus. And we're explaining that to families. And just a visual here, just so folks can see, at one time, we thought we were going to have to do 6 feet social distancing required on a bus, and you can see what that looks like. We did that exercise with the board back in May. And if that were to happen, we're talking about, instead of 80 kids getting on a bus, drop off a bus, or 70 to 80 kids at Frank in the morning, now we're talking about 13 or 14. We just can't do it. Physically, we can't do it. But having 2 riders to a seat, you can see how it's laid out, with the seats, if you haven't been on a bus in some time. That's the best we can do. And even with that, there's significant change coming with that. As we move to our elementary plan, we're proposing full day from Tuesday to Friday. Monday is the remote learning day. So no students physically attend unless we have medically fragile students who need to come in for certain assessment or other purposes. Students will remain with their homeroom throughout the school day. And I think that's, again, important to stress that we're not just it's not business as usual. And we're not throwing students back in together and mixing them up. They're going to be encapsulated as they go through. They'll remain in their homeroom, in their class throughout the entire day. Fourth grade teachers who often departmentalize instead of kids getting up and moving across the hallways and giving each other high fives as they exchange classes, the teachers will be coming to them. So we're really trying to limit in every aspect of what we do. Art, music, library, teachers will be deliver instruction in homerooms. Physical education could be outside when warm weather permits. We can disinfect the gym, equipment between classes, and again, it's going to be very challenging to clean all those areas while kids are coming in and out of them throughout the day. We want students to eat their lunch in their homeroom. Outside on certain occasions or in the cafeteria gymnasium, again, those occasions are only in their homeroom. Students report to the cafeteria in a staggered fashion to pick up their lunches. And when you think about lunch service, that's another area that is going to change. Students would line up for their favorite meals and they'd be in rows and going through the lunch line with each other and pointing to the foods that they want. We can't do that. We have to design a system now where how do we keep students separated as they get their lunches? So that's something, well, again, it's when the board says this is the direction we want to go, we'll be talking more about how we can do that safely. But there will be some changes in that area. Outdoor areas will be designated like zones for recess, where they play with just their homeroom. And recess could change. Again, this is one of those things that we're projecting now, but once we get into the schedule, teachers are very creative and they know they're going to do the very best for students. And I have no doubt that they're going to come back and say, hey, we can do this and we can do that. They're going to think of things that we haven't thought of. And I'm excited about that and counting on that. But for right now, we know that recess and how often and where is going to change, but we also know that we have teachers that are going to think of creative ways to make sure that school is a fun place where kids can, be together and do the things that they want to do. We're encouraging staff to take their students outside as appropriate. I know that was a discussion item on Friday, and we want to make sure that we're encouraging that as much as we can. And certainly in Northwest Ohio, that can be challenging with the wide swings of weather. But we know that it's important for students to get out there, to engage and do those kinds of things as much as possible. And again, I think our staff will embrace that challenge. So here's a sample where a student arrives, about 8:50. Classes begin at 9:05. And they'll be in their homeroom, 45 minutes of encore. Those are the classes that are listed. Again, coming to their room with the exception of PE. Students have 30 minutes of lunch in their classroom, and then 30 minutes of recess outdoors, again, in those zones or in the gym, wherever it's possible where we can make that happen for them. As we move to HPI, again, that's in person, full days. At that time. Monday is remote learning day. No students will physically attend, but they're going to remain with their team throughout the day. The overall transitions in the school day, because again, HPI was the teams were moving and going from class to class, engaging with other students. They have more electives at this time, and we'll talk about those. And we were able to reduce those by 30%. At the grade level transitions will be 60%. So we've actually looked at the number of times students were mixing with other students, and the goal was to reduce that. And Mr. Best and his team really did a nice job of trying to reduce those exposures. We're suspending exploratory classes, performing arts, and elective classes. And again, the reason being is that you can be in different teams and signing up for different electives that you want to do, and it's just bringing a lot of kids together. And that's a real challenge for us. And also those teachers are shared with other buildings, and it becomes very challenging for us to be able to continue to figure out a way to make it happen. So again, our goal is we'd love to have, this opportunity, but once we begin the school year and begin to make these changes, it's very challenging to make them on the fly, back and forth. So again, we're starting with a great deal of flexibility, and we're hoping that, as we learn more about the conditions of things, we want to reinstate that as much as we can, but we know that there'll be some challenges with that. Lunches will be eaten with the same group throughout the year rather than switching every quarter. Adjustments will be made to student seating to allow for additional spacing. Creative arts classes will be composed of students with the same team rather than two teams. So again, that's a significant change. Recess would be eliminated, the way that we do it there. We can reassign 4 monitors to the commons to help with supervision cleaning during those lunch periods. Because that's going to be a significant heavy traffic time in between those encapsulated groups coming into the lunchroom. And so here's a sample schedule where we have students arrive between 7 and 7:50, 60 minutes core classes with their team, 50 minutes of creative arts with their team, the lunch jacket periods, there's those blocks, and then the staggered dismissal. Transition times have also increased by 5 minutes, and that's part of the way that we had to change our schedule, which reduces those electives. Allowing students to have that staggered, you can't have a staggered change if you only have 5 minutes to make it happen. So part of that is allowing for time within the day to do that. As we move to our junior high program, this is where you see a shift take place in this level 2 and level 3. So in-person full days, Tuesday through Friday. Monday remains a remote learning day in level 1. Currently, right now, we're in level 3. We were in level 2. In that scenario, we would be in the blended model, 40% in person, 60% remote. And students would be divided into 2 cohorts. Each group attends in person 2 days a week, Tuesday, Thursday, Wednesday, Friday. Remote learning occurs on the other days. Students are expected to access remote learning on those days that they're not physically attending. And this will be a subtle change from what happened in the spring, where we need to have that evidence of students logging in, participating, doing the work that they need to do. And I know this spring there were students that, had more not logging in every single day. And again, this is one of those areas that we're going to have more information coming to parents. But this is an instructional day. We need to hold students accountable for that material on those days. So it's not I'm going to sit this day out and I'm going to come back in 2 days and make it all up all at once. So we heard stories about that, and I know that's going to be something we have to do a better job of this go round. And we've learned a lot. Here would be an example of a schedule in level 2 or 3. And essentially it's that every other day model that reduces the number of students that are attending. Regular school day schedule, so they would go at the beginning of the day and get out at the normal dismissal time, and go through their entire day with half their class. So if you're on the gold team on Tuesday, you're in getting the material. That also what's happening on Tuesday is that teacher is also previewing the work that you're going to be responsible for on Wednesday. So on Wednesday, while you're at home, you're working on that material that the teacher has introduced and has set up in our learning management system, Schoology. Now on Wednesday, those students are now getting that lesson. And then on the black team, and then on Thursday, they're having to do that work. There's some folks that say, well, my child's only going to school 2 days a week. And the same with the high school. And what we want to remind folks is that this is introduce the material, go over it on one day. The next day, you're setting up for that learning environment where they're going to be at home. And, when you think about those that went to college or university, you might have only had classes 2 or 3 times a week. But if you did it right, you were very busy all week long. So this is more of a model when you think about, okay, I'm in for 2 days, but I have a lot of things I have on the syllabus and things that I need to be doing outside of school to prepare for those times when I'm coming into school. And that is the transition that we're really looking at. Last spring, we had to change in the matter of a day. And we learned a lot. And this is one of the things that we receive feedback from families and teachers alike. Siblings will be scheduled to attend the same schedule. So, we want to be as least disruptive to families. So we will have students who, junior high, high school, we're going to make sure that we're trying to align those siblings so that they're on that same schedule. And we think we have a way to sort that between those two buildings. And then with our high school, very similar to the junior high, the schedule breakdown, very similar as well in terms of splitting the cohorts. There's no way to encapsulate junior high and high school students because of the variety of courses that they take. If Sue and I were first graders, we would take the same, science and social studies. She'd probably be a much better reader than I am, so she'd be in the Bluebird. I'd be in the Robin group, and that's how it would go. But we'd still be in the same classroom all the time. But as we move into the junior high and high school, Sue and I may share our 9th grade English class together, but she's taking French and I'm taking American Sign Language, and she's taking geometry and I'm taking, intro to algebra. So those are that makes it almost impossible to take a handful of students and design a whole schedule, because we have to have that flexibility that if we come back full time, we can't redo the high school schedule in the middle of the year. So we have to be very careful with how we design it so it can easily move back or forth. But when you think about 1,700 students, each of them have to have 7 different options. And all of them have to have required classes that they need to take every single year. And they're taking these crazy classes and schedules, and it is a monster to try to make sure every student has a class every single period and that class is leading towards graduation. Because if you don't have that, it creates a huge problem. So saying things like, well, we can switch to block scheduling that was talked about, or we can switch, can't you just grab 50 kids and send them through a cohort together? And then, well, if things change, all of a sudden we can't have a student in the middle of the year saying, I'm going to lose credit and I need that to graduate because you've changed the schedule now and I can't get that class. So whatever we come out with, we have to have basically that footprint, just variations of it. And I know it's very complicated, and I'm probably not doing a great job of explaining it, but when you're talking about thousands and thousands of courses that are offered, divided up among 1,700 students, all of them counting towards graduation, the minute you make one change, 2 changes, all of a sudden you've undone 17 other changes, and it gets very challenging for us. The relevance rigor in our standards, we just wanted to say that students are expected to be engaged in learning 5 days a week. The faculty will be expected to be introduced new materials and engaging students in face-to-face and through the learning management system with Schoology. And that has to be happening every single day. AP and honors courses, I know I fielded some calls from some parents about that. And it's likely that this could even be more rigorous than what we have now, because it's actually going to be, set up where these students are going to have to be more independent with these AP and honors courses, these advanced courses. It will be geared more like a college course, where here we're touching base, here are the things that you need to do on your own, you need to bring it back to me, and then let's see where you are. So that's going to open up a lot of things with those upper level classes. We talked about the university classes a moment ago that meets 1 to 3 times a week, but that doesn't mean that that's all you're responsible for. The only learning that goes on is just those 1 to 3 days that the university class meets. So I think this is helping prepare for that concept even more. And having that blended approach versus the fully remote in spring is going to provide more accountability. You're going to see your teacher in just a day or every other day. So if you're going to just, I'm taking care of everything, Mom. Don't worry about me. I'm upstairs in my room working, studying. Well, that might work for a while, and we heard stories about that in the spring. But in 2 days, you're going to have a teacher saying, show me the goods. So there is going to be that component there. I think that's really going to change that whole dynamic of that blended learning. Versus before, we couldn't legally have people assemble. Now we're going to have an opportunity to be with them, to evaluate, to assess. The other thing is we're also offering a full remote K-12 plan, and this is very important. We will have, for a variety of reasons, students that are either medically unable to attend or not in a position where they feel comfortable attending, and that's fine. These are our students. We want to make sure that we're providing for those students the very best that we can. We want these students to remain Perrysburg students. So with that, we have been working in teaching and learning, and Brent Swartz-Miller has been looking at different online curriculums, evaluating what fits with our curriculum to the very best, which provides that rigor. We've made a selection. So students who are exploring this as an option, we now have an online partner that is going to help us provide that curriculum and content to our students. We'll have Perrysburg staff managing, supporting as much as we can that online learning that's taking place. We ask that families consider making a semester commitment at a time. Some families are going to say, I'm all in all year until we heard the doctor say, until there's a vaccine. This could be a year and a half. That's fine. You don't have to just opt in for a semester. You can say, I'm doing this. But the reason we do that is when you're transitioning from an online environment into a classroom environment, we need to make sure that your credits are accounted for, especially if you're in junior high school type of courses. Because essentially, we don't want to get into that situation as I described, where you're 3/4 of the year and you're completed with your online course, and now you're transferring in. You're not going to have that teacher that we're transferring you into. You're having that online experience. So we have to be really thoughtful about when we choose to do that. We're also exploring the opportunity. We have some families that say, well, I'd like to try it. So our goal in our early conversations is their ability to have somebody maybe that first week or two say, this isn't going to work out for me. And then we're going to go back to this blended model. If that's the case, we want to work with families to the best of our ability with that. So it's our program that we're partnered with a great organization that is very skilled in providing that curriculum, over 600 different courses that they're bringing to the table. And so we're very excited about that possibility too. So a registration email will go out and sent to all families. And again, with a deadline, because we have to begin planning for that opportunity, but more information will be coming. Extracurriculars, this is an area that is really challenging. In May and June, when we presented on our back to school plan and conversations, we knew that we were waiting for guidance from the Ohio High School Athletic Association that governs most of the extracurriculars that we think about in sports. The OHSAA came out recently and said it is up to each individual school district to determine whether or not they want to have athletics. You will have to make that decision a district at a time. We are there. Our job is to provide, I'm summarizing, and these are my words, but our job is to run state tournaments, not to tell you when you should and shouldn't have athletics. So we have been continuing down the path of preparing, taking precautions, having our student athletes prepare for what could be a fall season. And with that is also those things that go to support that, marching band, and think about fall play and all of those kinds of activities. So if the board says, let's move forward with this plan in the next several weeks, we'll be talking with all of those stakeholders in our school community about how can we continue down this path? How can we offer this safely? Because the classroom is very important, and figure out a way to make it happen. But we also know that those extracurriculars, being part of the band and performing and having that experience on the stage, are life-changing experiences. And we want to find a way to make it work before we have to reach a consensus that it can't be done. Let's try. Let's see if we can come up with a way to make it happen safely. And if we can't, then we can go forward knowing we did our best. But let's see if we can figure out a way to make those things happen. And again, on Friday, I don't usually talk about this, but as a parent of a son who lost quite a bit, and extracurriculars in the spring was one of them, let's see if we can find a way to do it and see what we can do. And we're also part of athletic leagues, and we're having conversations across Northwest Ohio as to, how can we collectively do this? But again, if, as the doctor pointed out, you get into certain sports, I don't know how yet, but there's people thinking about it who are passionate about protecting kids and also passionate about those activities. So the after hours weekend use of facilities, we're the home of many activities. The community uses our buildings, and the board has always been very good about, let's make sure we're doing these things for the community. We're just gonna have to put maybe some of those things on hold. And again, we're gonna try to find a way to make it happen, but if we can't, we can't. But let's try. But we know that we have precious resources and time, and we know when people congregate, there's more of a chance of an outbreak. So when we think about all those after-school activities, we have to look at it through that lens. And the human cost for us to have staff going around, lots of people trying to keep the buildings and those spaces clean, sanitized, that's something we have to think through. And we'll have more information, on how we're approaching that. So the next steps, we have that back to school guidance document outlining a lot of those expectations that'll be ready to go if the board approves this, going in this direction. The back to school information will be sent electronically. We're 4 weeks away from school starting, by the way. So when you hear the panic in our voice, yes, that is panic. So we're 4 weeks away. So there's registration and all the back to school materials. We have to begin to move and push those things out. So in the next few days, there'll be a lot of the things that are listed here in the presentation that, for busing and full remote options. We'd also like the board to consider a special board meeting the week of July 27th to discuss the next steps. And tonight, if the board approves, we're changing the student calendar. And with that, we will also have to explore changing some employee calendars and getting into some of those kinds of things. So there'll need to be a series of activities that'll take place. Also with that, we want to give updates about the academic programming and how are things moving along. With rigor, what are the numbers of people that want the full remote options? What are you hearing, sharing that with us? What are we hearing, sharing that with you? So that week really begins to get into the more granular aspects of what we're doing. Like I said, we want the people that are doing the work, who are working with our students directly, having a voice and making those kind of granular decisions. We've tried to set up the parameters of how things can operate and then how to actually do it. That's that next phase, and we're approaching that. So students with on IEPs and disabilities, they'll receive information directly from that department. That is one of an area that's caused us a lot of conversations in terms of how we can provide services for those students, sustain those services. And their schedule may be a little different than the typical student. There might be some different schedules for them. And that is something that as a family, as a student, as teachers, educators, they have to agree to. But we're looking for ways where how can we maximize that experience for some of those that are most in need. And I know that that's something that Dr. Glesser is working on. So with that, I think that wraps up the bulk of things. Again, just from an overview in terms of what we're thinking and happy to answer any questions. And I know Brooke is still there, and I know she's been a little more granular. As we've looked at the high level stuff, I know she's been in the weeds already, in anticipation of this moment, so.
Thank you, Mr. Hostler. The floor is open. Board, questions for Mr. Hostler?
I started last time. Somebody else started.
Okay,
I've
Gretchen?
got it.
Okay, I have quite a few. Should I go through all of them?
Sure.
Okay. First of all, busing. If I live across the street of 795 to Woodland, do I have to run across that 795 as quickly as I can, or do I get bused?
Yeah. So there will be a number of roads that the transportation department will say, that's 5 lanes, if I'm not mistaken, 4 lanes, 5 lanes. That might be an area where we would say, even though it's less than that 2 mile radius, we're going to need to send a bus there because that is a problem.
Okay.
So there are a handful of those areas as indicated. So specifically, I can't answer that question about that.
I just meant generally,
Yeah.
if you have to cross a big highway, we're going to bus you.
So 795, when you think about a student that could be, as a crow flies, less than 2 miles from the junior high and have to walk under the underpass, the 75 underpass, that would be another example of an area that we would have to bus, because having youngsters navigating, getting through that intersection in the morning, just not safe. So,
Okay.
but I do know we'll have other families that'll say, well, what about other streets? So that will happen, and we understand that.
Okay, and my next question, open windows on buses. I have read that depending on where you sit, the airflow causes more problems than not. So if you're in a restaurant and the air conditioning is behind you, even though there's a big space between you and somebody else, if that air conditioner is blowing air past a table that has COVID onto me, even though I'm 10 feet away, I can still get it. So I wonder if bus windows are really safe to open. That's just okay. Is it possible to just ask everyone to pack lunches? Now, the next question. I have a special needs high school student who's medically fragile. Can this student come in on a Monday and get individualized attention? Is that what we're thinking, or?
Can you hear me at all?
Boy, just barely.
Pam, did you put the mic right there? Okay.
Brendan, we've had quite a bit of discussion, and our People Services Department is working very hard. There will be a lot of decisions that will be on a case-by-case basis with that IEP team. So they'll be working through a lot of those situations and really working with that IEP team to determine what's the most appropriate support and services for that student. So there could be instances where absolutely yes, that is happening, and other instances maybe it isn't safe, and maybe there does need to be a home instructor going to someone else's location. So I think that there's going to be a lot of flexibility there, but it's going to really need to be done with that student's individual education plan team. And then also, if I could just real quick too about your busing question, Gretchen. Right now, what transportation is doing, they're running all the routes K-8 based on the existing boundaries as they were last year. So we're hoping we don't have to adjust that 2 mile radius as much as we think we might, but we really are going to need people to register. It's going to be really important that people respond to that email when it comes out, because once we really have accurate numbers of who is going to need to utilize transportation, we'll know exactly how far out in terms of that 2 mile radius we're going to have to go. And obviously, if there are unsafe stops or unsafe spots, we won't be making kids, we won't put kids in those situations.
Oh, thank you. That was really helpful information. Thank you. Now, my next question, I am a medically fragile adult. My children cannot attend schools, so I want them to go online. However, my students are taking several AP courses. Can you take an AP course through the program that we're offering for online learning?
Did you hear that, bro?
So I know that they have, that's one of those questions that we'll have to get back to those specifics. So we know that there's over 600 courses that are offered through our partners. Which AP courses are available, I'm not 100% sure. So,
Okay.
That'll be that next phase of how will these courses be offered, what is going to be offered, and we'll be able to publish that.
But there will be AP courses.
I'd have to confirm with that.
We hope.
I don't know.
Okay.
I'll have to get back to you.
Okay, that's the end of my questions.
Anybody else? Sue?
Yeah. Oh,
Sue, yeah, Sue, Kelly, we'll get Sue, then you. Kelly.
Okay. This is a comment. I was surprised to see the mandated mask requirement. It was, to my knowledge, the first time I had heard of that. Not a fan. I'll say that right off the top, as she's talking through her mask. I think the science is behind students possibly HPI on down, that they should not be wearing a mask. There's just so many reasons why. I am not in support of that. I think that's a detail that doesn't really reflect on our vote tonight, but that's my personal thought. I'm not in favor of that at all.
Could you tell us why, Sue? Because on the flip side, I might be saying, oh, I'm in favor of the mask, everything I'm reading.
I think that the mask throughout the whole district, since we're seeing our older teens, our older students are getting this, a lot of that is behavior oriented, right? They're thinking, oh, I'm impervious to it. So they're coagulating when they shouldn't be. I can see masks for that. I can see masks for them in that age group because they're getting it. There's too much science from Europe that's showing that younger students, I'm a little vague on the junior high, but definitely HPI on down, that they are not transmitting the virus. If they get it, 9 times out of 10, they are asymptomatic. And they also do not transfer it to adults. And that is why these schools, as Gretchen pointed out, in Europe are going back. And they've been back for months with very little problem. So when you have that science and those reports in your head, and then when you look at these little guys that need our faces. I was teasing Tom last week when I was saying, oh, well, look, I can read your body language even with the mask on. But I've had X number of years to learn body language. Our little students they haven't had a chance to learn that yet. And that's part of their education. It's why we want them to be together. When you are covering up one of the main forms of communication as a former communications teacher, that really hinders their ability to learn these social cues, to learn this social interaction. And that really concerns me that we would do that. So now stop and think of every little germ factory that you've ever seen, and they've got runny noses with a mask on all day, or they've got a face shield on. Now they've got all of that, all over the inside of the mask. The teacher's going to have to stop, clean that shield off. I just don't think the science is there to warrant forcing that age group to have it. Now, if the parent says, I want my student to have it, that's a different ballgame. If the student says, I want to wear a mask, go ahead. But I think for us to mandate it is stealing such an important part of their education away from them. A whole strong reason why we're trying to get them back in person and putting them 4 days a week together. I just really struggle with that.
What grade level are you talking, K to 3?
I was thinking the junior high is a little vague, but definitely HPI on down.
Okay, I just want to, we can talk about that and discuss it some more. But more questions for Tom?
Yeah, I'm throwing that out as something that surprised me because that's the first time we've talked about it. Tom, you talked about virtual meetings. You were talking about parents
Yes.
meeting and such? Okay.
Yeah.
Which bill was it? HB 190 something or other? Was it 198?
I was going to say 7, but I'm not sure. But yeah, it's right in there.
Whichever the 190, whatever it was, that is allowing Kelly to meet with us virtually and Brooke. That stops December 1st. Will that affect parents meeting in that way? That's a different animal?
Yeah.
Okay.
That's a good question. The board is a government body and it has to do its meetings in a very prescribed public way. And that's why the law changed to allow this to happen. But in terms of having meetings with parents, there's no it doesn't have the same legal trappings that a board meeting would have.
Okay.
So,
Well, that makes sense. That's what I was hoping the
and
answer would be.
I think we want to communicate with parents to see what their preferences are, because sometimes there's conversations that you need to have in person.
Yeah.
And it's important that the parents are there present to be able to express their concerns and to hear the staff's concern. But if it's everything is going well, we need to have a check-in, an IEP meeting, I'm communicating with my child's teacher and the team very well. Do I need to take a half a day to drive down to Perrysburg to sign forms and, so I think those are the kinds of things we're getting at. So,
Good.
yeah.
Good. Okay. You had mentioned that there would be some financial adjustments for preschool. Will there be any financial adjustments for all-day kindergarten?
That's great. We didn't have any slide addressing that, so that's my fault. So
Well,
we will offer all-day kindergarten 4 days a week, and it will be prorated according to the 4 days.
okay.
We also have a half day every day for 4 days option as well for families.
Okay. A busing question. I know you're not James, but and we didn't bring this up in our operations meeting, which really surprises me that I didn't think of it then, and I apologize. We're not busing high school, but if we're busing some of our students to the junior highs at St. John's or Notre Dame Academy, for example, we'd still have to bus those kids, wouldn't we? Since they're junior high, or would we do it in lieu of, and if they do go, do we throw their high school brother or sister in the bus too?
Right. So we're obligated to provide transportation K-8 when it's deemed, when it's practical. And when it can't be done, then we have to say impractical. So we would have to take a look at, that's why in the next several weeks, figuring out who's going to be riding and how many other buses do we have in play is going to be driving that answer.
Okay.
So because our first priority is to do what we legally have to do. Now, legally, it says that if it takes all of our buses to transport ours and St. Rose students here in the district, and we don't have any drivers or buses to physically spare to run up to Airport Highway or Monroe Street, then that's impractical for us, and
Gotcha.
we'd have to do that. We
Okay.
partner with Rossford on those, so we'd have to check in with them to make sure that they're not having the same, issues and what's capable. Adding high school, the same argument could be made here, saying you're driving. My child's a high schooler, can't get to school. You're driving right past the high school every day. Why can't you just drop that child off? It's not that far out of the, all of a sudden, if we're not doing 9 through 12, then we're not doing 9 through 12, period. So, because there's going to be lots of, well, on the way back, you go right past the high school. Why in the world can't you just let them off very quickly and let them run, across the field,
If only it were that easy, right?
Right.
Okay, last question. I know Bowling Green just announced this, and I've heard the panic in your voice several times over the past several days. Is there any interest in Perrysburg changing our start date?
Yeah, I don't see that. I know that different districts have different reasons for that purpose. For us, I don't think there's any. For us, I don't see a benefit in starting later, other than just being able to get these questions and things worked out before we would start. I mean, that would be the advantage of that for us. There's physical things I know in different districts where, starting later in the year is better, especially with their buildings. So I can see that being a factor.
That's true, because they don't
Yeah.
have the air conditioning now.
Right.
Is
But-
there a drop dead date for you to make that kind of decision? I mean, if all of your teachers came up to you and said, please give us another week or something like that, is there a drop dead date?
Yeah,
We're probably already past
Yeah,
it, right?
I don't have an answer for that.
Okay.
I think we'd have to explore. There'd really have to be a good reason. What aren't we able to provide in those first few weeks to our staff? Or what issues are popping up that we can't resolve to be able to start the school on time?
Gotcha. Okay.
So if there was something that if I came back in a week and said transportation, we're going to need more time, then we're going to have to do that. Remember at Hull Prairie, after a week of opening that building, I came back to the board and said we need to change their hours.
Yeah.
Can't make it work. I mean, sometimes that happens,
Yeah.
but right now I think we're in a position where, as we start to hear feedback, that may change, but right now we're going with that target date.
Okay. All right. Well,
Yeah.
God bless you. Good luck with that. I yield the floor.
Kelly, you were next. Questions from Mr. Hassler?
Yes, I had a question about the masks with the K through second grade. They are going to be required to wear a face shield and not a mask. Is that correct?
That's correct.
Correct. And we're providing those?
Yes.
And is it an option for other grades to wear a face shield and not a mask?
At this time, what we're recommending that would be no, because really in multiple conversations with the Wood County Health Department and Ben Beatty, we talked a lot about the level of risk, and cloth masks are safer. A face shield's better than nothing, but cloth masks are in general safer. They keep more of the particles contained closer to you. But a face shield is better than nothing. And we really, again, that's that risk versus benefit. The risk with younger students and the whole issue of being able to properly wear a mask, the mask being more sanitary, not getting as wet throughout the day with runny noses and all of that type of thing. We thought that was a good balance to give those little kids an option to have a face shield instead of having to wear that cloth mask throughout their whole day when they're in their classroom. But then when they are moving out through common areas, again, the whole concept behind a mask is when everyone's wearing it, we're protecting everybody. So in those high traffic areas, then that those students would have a cloth mask as well, even the little ones. And then one more note about the face shield. So we're planning on giving all staff both a cloth mask and a face shield so they have the option to layer, because layering is much safer. But we also have some specific guidance for staff. To Sue's point, we know there's certain activities For example, if you're a speech therapist, or if you're a first grade teacher teaching phonics, or maybe you're a science teacher and you're doing a lab where it's not safe to have a cloth mask on your face. So there would be potential activities during instructional time where that teacher may need to remove their cloth mask and just leave on the face shield for that activity, because it may be a significant hindrance to be able to get their content across. But again, when that activity is over, the cloth mask is safer. And I think going into the school year, we haven't brought this many people together for 7 hours a day in contained spaces. And starting out safer with those precautions has been recommended to us by multiple health professionals. And again, to Tom's point, we're going to be flexible. Things are working out well. We can make adjustments as we go, but certainly erring on that side of safety to start out the year is what our thought process was. I'm sorry, Kelly, I know you had another question, so.
No, I'm listening to what you're saying. And so if we're going to be flexible, why don't we give it an option for people to wear either face masks or face shields, or masks? What if you had a child that has anxiety, or what if you have a child that has a respiratory, like not COVID, but just in general, like allergies or something where they're always having, nasal problems and they cannot wear a mask?
So Tom mentioned on the last slide that there's going to be a back to school guidance document, and there is a pretty extensive mask expectation guidelines in there. And so if there is a documented reason why someone could not wear a mask due to some type of physical or mental impairment, and again, it needs to be documented, then that will be discussed on that case-by-case basis, and that would be taken into consideration. So I think that again, a lot of things we discussed tonight, there's going to be even more detail coming all in writing in a whole back-to-school document for all families to see. And it is in there what is listed as possible exceptions, and then the process you would take if that's the case. Because there may be those situations. But I also think we have to make sure it's not just someone writing a note that they don't want to wear one.
Sure. And then I had a question. At the beginning of the presentation, Tom talked about recently you guys had to send a letter out to students' parents or something. What would be going on now that we would have to do that? Obviously, school's not in session. What activity are we talking about?
So we have lots of different activities going on with athletics.
Okay, so I have a huge problem.
Kelly, excuse me. Kelly, can I just, point of order? Can we just ask questions about Tom's presentation, and we'll discuss, I think I know what you're going to get at, extracurricular activities. If we could just have questions pertaining to the plan, and then we can cross the bridge to move us into the next discussion phase, if that's okay with you, the board is. I want to get Tom's questions about the plan he's unveiled today.
That's what I thought we were doing right now, is just asking clarifying questions.
Yes, clarifying questions. Could you save that question then?
Clarifying.
Yes.
I was clarifying what exactly we're talking about, who got sick and why, which ties back into school. But okay, I'll wait.
If you don't mind, that'd be a good question for our discussion when it comes to resolution. But I'd like to get questions about exactly the plan, the framework that Tom has presented to the board Friday and today. Do you have any more questions about the framework, Mrs. Eubank?
Okay. I do about the instructional part. I think we all received an email asking about the instructional component of the 7 through 12, where the teacher, if I'm understanding it correctly, is just going to be teaching a subject matter, repeating it twice a week. So there's only instruction 2 times a week that the children are getting. That's the 40% of the time that they're in the building in person. Is that correct?
No.
No. Oh, sorry. Go ahead, Tom. Sorry.
Yeah. No. During the presentation, we talked about that because I know that there's a perception. So I appreciate you asking that, because I think people assume you're only going to school twice a day and you're only getting taught twice a day. But one of the things that we talked about is the fact that there are expectations that the teachers, introducing materials on that day, and then they're setting up those things that need to be covered by that student on the day that they're going to be remote. And then when that student comes back the next day, there is accountability for what are those things that have been done, making sure that the student did those on that day off. Not much different than what happens in colleges and universities when students go there. If you're a successful college student, you just don't show up the day of class and that's all that you're putting into it. There's so much that goes on outside of class in preparation for that next class. So it's really a shift to that kind of environment. So I don't know if that answers the question or not, but no,
So on the days that they're home, they're self-teaching using material that a Zoom, a meeting, I'm not sure I'm understanding the concept of when they're, online learning. I guess some question is it going to be like the same hour and a half that it was in the spring, or is it going to be more robust? What exactly is the component?
Kelly, I'd like to say something I'm sorry to interrupt here, but I think what Tom and Brooke are trying to put across here is there will be 5 days of learning. How the teachers choose to develop their coursework for those 5 days, that will be up to those teachers. Some teachers may do flipped classrooms. Some teachers may video a class while it's happening. I think we have to give the teachers the flexibility, but we have to hold all staff accountable to the fact that they are providing 5 days of instruction. But I think it's too premature for us to say, well, this is how we're going to do it. The teachers have to come up with that.
Yeah, there's a couple of slides in the presentation that address this specifically. And I just pulled up slide 41 where we said that secondary level rigor, relevance, and our standards. Students are expected to be engaged in learning 5 days a week. Faculty is expected to be introducing new materials and engaging with students face-to-face and through the learning management system, which is Schoology. AP and honors courses will likely be more rigorous than the traditional delivery models that require students to be more independent, almost exactly like a university type of course. Having the blended approach instead of the totally remote in the spring provides more accountability, because the spring you had a son or a daughter who would go up into the room and say they were working on things, and 2 weeks later you find out they weren't. Here, within a day, they're back in class with that teacher having to be accountable for that material. That's a big change. So that's, so we did talk about that. In terms of how Schoology is utilized, that'll vary from teacher to teacher. Some teachers may record themselves teaching a 10-minute lesson and posting that. Others may link to a YouTube video or another educational video that they want them to watch and then react to. There's online materials and stories and writing submissions. All those things can all happen remotely on those non-instructional face-to-face days.
Anything else, Mrs. Eubank?
No.
Mr. Bennington?
So I know this board's probably really ready to get into the discussion, so I really just have one question about the framework. Tom, Mr. Hostler, what has been the teacher's involvement, the staff's involvement in looking at and commenting on this framework?
Yeah. So this has been an area that has been a challenge for us because, one, we were waiting for so long, July 2nd, to get the guidance as to how do we move forward. So pulling a large number of people together, planning for something that may or may not happen or even be on the table, that was a challenge. So what we chose to do during this period is that through basically 2 different methods. One is principals through their building leadership team. So each building has a building leadership team that meets regularly, that talks about different issues. And as things have come up, we've asked the principals to convey those questions, gather that feedback, and then they've brought it to the table for us. So that's a good cross section in every building of teachers. So each principal, we've relied on them to bring that information to us, and they've brought it through a variety of ways. The other thing that's happened has been, for the most part, weekly meetings with the PEA, the union leadership that represents all the teachers. So we've been communicating regularly with them, sharing information. Many of the materials that I share the board during the week, I'll share with them as well, so they can see what we're thinking and the direction. They've been good. They've asked very, very good questions. They've raised issues that have caused us to kind of think through things differently. So we've relied on that to get us to this point. But to this point, moving forward, is really where that staff, those experts, their voices are going to be most important. Those are the decisions that are going to make or break that child's experience in the classroom. We're kind of blocking for them. We're taking the big things and trying to push them aside, like how many kids can you get there? How are you going to feed the kids? But the fine art of actually teaching, the care and nurturing of those students, that conversation is now what's going to be paramount to what we're doing moving forward. And so that's where their voices are going to be more important now than ever. And as we get closer to the heart of why we're all here, which is that student in that classroom, it's their voice is going to be most important. And that's kind of how we've structured this. So that slide that I said, the why, that's something that we've kind of wrestled with those groups. The what, it's been those broad strokes with those groups. Now we move into the how. There's questions you don't want me answering on behalf of that third grade teacher, but they're the experts. Let's let them find a way to make it work. And I think, again, that flexibility, there's going to be pieces of this that we think today are going to work. And we could very likely get into a classroom setting and have the teacher say, good idea, not going to happen. And here's why. We want that flexibility, one, to get that feedback and to be able to respond to that. That's the key word that we keep saying over and over again, is flexibility. And this is our plan with the mask, for example, and I appreciate, the commentary on that. If we start with that and we get into it, and we have a number of teachers that are saying, this has become an impediment to our classroom environment and teaching, and then we have to address that. That's where that flexibility has to happen. We don't know as much as we'd like to about how this is all going to play out. And that's where those voices are going to be so important. So the plan that we're laying out here, again, is asking for your support, but it's also asking for your understanding, your patience, and allowing us to be flexible to make those decisions, because we want to make them for the best, to give that student that experience, to want them to come back to school. And if there's something that is prohibiting that from happening, that is within reason, then we're going to have to look at that. And we should look at those things, as we move forward. So yeah, the staffing piece has been, in addition to the focus groups we've done with different community groups, like with the PAT, we did talk about the back to school, the plans, and also the parent survey, which was a great response. So there's been other pieces. In addition to that, this was the third time I've had an opportunity to talk to Dr. Hanrahan, who provides a very different perspective than Mr. Beatty, who he and I talk on a weekly basis. So we've also relied on those things, and also just best practices from around the state, from around the country, talking to superintendents in this area, because we know that's what parents are going to pay attention to. So, we've added all these ingredients to this stew that we have here. And, it's cooking, but it's not done. So
Don't eat raw dough.
the doctor said, please don't, I'm not using a comparison of children to prison. So I'm not using children as a component to a stew. So, but you get the idea.
Mr. Hostler, I have just one question, but again, I want to thank the community for their questions that they've sent to us, to Mr. Hostler. Some of those questions have been addressed in the presentation. some of the questions have been addressed with board members asking questions, which is very thankful for that. And many more questions we don't have answers to, but we will as days approach and as the plan starts to fold out. My only question is, there seems to be some flavor out there popping up about how we can Zoom a live classroom. I don't know if that, I don't remember any presentation with that in there, nor I understand the feasibility or possibility of that happening. So can we squash that or address that? Is that possible with Zoom or Skype or Classroom Live?
Yeah. So there's a couple different challenges that we have with this, and I'm going to step into Brent Schaefer, who's here today. So I'm going to step over into his world just for a moment, and then he can jump in if he chooses, he feels he needs to. But there's a couple different things that are in play here. One of them is an infrastructure issue. So when we went one-to-one, we used a lot of permanent improvement dollars to wire all of our buildings so that we could have the ability to support students and their devices. So think about your home when there is Netflix and, you know, Prime and Hulu and gaming all going on. What happens to your internet, the response? Now imagine that with 1,700 students that are all online at the same time in a building that was built like a fort, where these things don't go through concrete walls, cement walls. So we had spent a lot of money to wire everything together to support that. By adding Zoom and other types of platforms that require more bandwidth, there probably would be a need of additional supports in the network just to keep that up and running and not, you know, bogging down or crashing. So I think there's an infrastructure issue there. There's another issue there as well, where we'd have to be very, very careful with how we would set that up, because there are many privacy issues that surround students in a school setting. So for example, if you've ever noticed when the media comes to a school and films students about a story, they usually do what? They film their feet walking past the camera, or from a far away where it's out of focus, because it is a little bit dangerous to put out into the web images of students. And we have a number of students that parents, families sign a waiver saying, my child cannot be photographed. There can't be any use of my child's image. So we would have to coordinate with that as well. And even with that, you get into another where there's a conversation that's happening. So you don't know who's on the other end of that and what they're recording. And if you have a teacher who calls on a student and there's an exchange with that teacher and student, and that goes viral, that could have a significant problem for that student or that teacher as well. So there's lots of not only structural problems, but also some practical policy and other types of what we call FERPA, the Family Educational Right to Privacy Act. You know, if your child is in that classroom and it's being live streamed to who knows where, is that really providing them with that educational privacy that they have a right to? And I think we'd have to tackle those issues first. So colleges and universities are wired, they can do that. It's a little bit different. Those are all adults sitting in those classrooms agreeing to have the camera. You know, when you're talking about young children, it's a different conversation. So.
All right, thank you. This time I ask for a 5-minute recess. Okay, we'll take a 5-minute recess and come back for item number 4, Treasurer's Report. Thank you.
But wait a minute, I have a question. We're not going to vote on this?
We'll come to a resolution, and we'll have discussion. If we look at item number 13.2,
Oh, okay.
okay? At that point, or sorry, 14.1, we'll have discussion.
Oh, that's right, I remember now.
We certainly
Thank you.
will. We're not leaving until we do.
Maybe midnight.
Yeah, 5-minute recess. Thank you.
All right. Everybody heard me say, I go, I fried chicken is gonna give me a.
I don't know, but yeah, we got.
I don't mean to get impatient with Kelly, but when she asks a question for the third time, or she asks one that is clearly already been addressed, people start to, I didn't even, move on, move on.
Well, welcome back from recess. Just want to make sure your mics are on, so we're back live again.
Back on? Yep.
All set? Okay, with that, we'll go with the treasury report, item number 4. Mr. Harrington?
So, Mr. Hostler, would
Yep.
you call up just a couple slides? We're not going to go through the whole packet line by line. You can call that one for the next one, the next PDF or the.
Is it that one?
No, keep going, there's another one. Like that, on the board doc.
Okay, sorry.
Sorry.
Yep, just bear with me. Sorry, I had it up and I accidentally closed out of it.
Hello. That way it doesn't, it's not sideways.
Yeah.
But it doesn't really matter. You can go back to that other one, Tom.
No,
You
that's
can turn it.
okay.
That first little box that says start the meeting or whatever is you have to click on now for some reason.
This one?
Yeah, that funny little,
Okay.
then go to the, it's just a couple slides I wanted to show to. Nope, next one, the first one. I'm so sorry. I gotta learn to do this myself. That way I don't have to
All right, sorry.
bother him. Okay, so the first, the next slide, I just wanted to go through and just kind of recap really quick. You know, we're June 30th. Let's go through a couple of things that happened this year that we've just been discussing. I don't want to do a full, 45-minute report, although I would like to, but I'm not going to do that to you. But so on March 14th, the director of the Ohio Department of Health ordered all school buildings that provide K-12 instruction in the state be closed to students starting on March 17th. Then they later extended that. And so while our buildings have been closed, our students have been participating in remote learning, and the board, the superintendent, and administration and continue to make our students our top priority. So let's just do a couple notes of interest in our revenue. As you can see, the first column is June this year, second June last year, and the variance. The next one is the previous year to date, current year to date, and then what we had originally forecast in May. Just kind of wanted you to see this up close and personal so that you could kind of look at it. Our budget was reduced, if you remember, May 7th in 2020 by the Ohio Department of Education. They cut us $972,945. Then on June 19th, the legislature passed House Bill 164 that gave us back $168,458. And while continuing to make state foundation reductions, so we are not going to count on any future increases in the state foundation at this time, obviously. And if you remember, we received a one-time donation from the Whittle family this year. That was a nice thing that happened this year. We did have to refund over 750 payments to parents due to the COVID, due to the tuition and other things, pay to participate in several things. So you kind of put all that together and you come up with our forecast was versus actual was pretty close. So if you want to go to the next slide. The expenditures are running about 0.34% higher. If you recall back in November, we said that was going to be 4.65% higher. So there was I guess the good news is overall expenditures were forecast at 4.6 and they actually came in lower, mostly because of the fact that we had the buildings closed for 3 months, which resulted in a savings of about $170,000. If you look at line purchase services, you'll see that we had forecasted 700. Our forecast we came in less than our forecast. However, we do have some open encumbrances that might be included in there that you do not see on this report. So again, at the expenditures for payroll came in right where we thought in May, because we updated it because we have not been doing professional development and we have not used substitute teachers. So that was the difference in that line. So overall, next, sorry. As you can see, our expenditures and our I like the graph because I think it's a great visual where it shows we were far apart. And now, even though with everything that's happened at the end of the year, we're still ending showing the 3 million. I'm having a really hard time seeing it up close here. But after our encumbrances, which we are going to be adding to this report, because I know it's been a request that we show some of the encumbrances at the end of the year or at the end of each month. We did have about 380,000 in encumbrances when we closed the books, and those happen because we have outstanding obligations to other organizations. Sometimes utility bills don't come in time. Sometimes we still have children attending summer extended programs because they need to. And so overall, it's no big surprise. This is about right where we thought we were going to end. So if you would like to take some time, well, I think we had our reports out there, but I know they're kind of hard to understand. So if at any time, I wanted to share with you, feel free to email me any questions that you have, even after the meeting tonight. This is a quick overview of the month end, but the packet that we include in there has a lot of information that that has like all the slides and has the checkbook and has the financial summary and everything that I think some of you are getting more used to. But at this point in time, what we're doing is we've cut the budget like you've asked us to. If you recall, you said to appropriate the budget's only 50%, which we have done. We are keeping a very watchful eye on everything we're doing. We are tracking all expenditures that we're spending for COVID in the hopes that we might get reimbursed for that someday. And the buildings will be back hopefully here in a couple of weeks, and we'll get things back on track with them. And I really think overall that our cost containment plan is coming around as best as can be. We're watching every angle to save money, working really close with Mr. Hostler and the administration. Every day we try to find ways to save money and cut costs while providing the best education. So that was a really quick overview, but like I said, we did a pretty in-depth one last month, so we don't really have it pretty much right on track. So,
Okay. You need approval for that then?
yes, and I will need a motion and a second and an approval.
Your motion?
So moved.
Second?
Can I ask one question, Pam?
Let's get the motion on
We
the table.
have a motion, and then we need a second, and then we'll have discussion.
That's the question.
Second. And now we have discussion. Go ahead, Kelly.
Go ahead, Kelly.
Okay. Oh, thank you. I have a question. Can you explain under the other receipts why last year we were at 200,000 and then this year we're at 800,000?
Because we got a donation from the Whittle family. You're talking about the donation? Yeah, we got a donation.
No, I don't. Of how much?
500,000.
At 500,000.
Pretty much that difference.
Yeah, we got $500,000. So 500,000.
And so the difference, 300,000 is from what?
So those would be a part of that is from that money that we received, that 168,000 also, the money that they said we were going to get. So that's part of it. And then we got catastrophic cost reimbursement really kind of early well, you can look at it one of two ways. We got it in June versus July. So I like to think of it as we got it early, but.
Okay, any other questions?
So that donation is separate from what they gave to Perrysburg Schools Foundation?
Yes. That was a separate. Remember it was from them.
Any other questions? Roll call, please, Mrs. Harrington.
Mr. Bennington?
Yes.
Mrs. Blair?
Yes.
I'm sorry. I didn't know who seconded. I'm sorry.
Yeah.
Mrs. Eubank?
Yes.
Mrs. Downs?
Yes.
Mr. Coleman?
Yes. Now June financials?
Well, that was kind of the packet. So then the packet, it goes into a little more detail. So we just needed to approve the June financials, but the whole packet is just your backup data. But I wanted to kind of highlight the payroll and benefits page in that, the whole big packet.
Yep. What
And then you
page?
guys really kind of take a look at that. It's kind of I think it's an interesting report. So So if you can look at it's the other packet, Mr. Hostler, well, there you go. You're on it, I'm sorry. So this is just for your review. I just wanted to highlight the fact that we do provide each month, if you want to go down just a little bit, continue down, a general fund and a payroll and benefits report. That one there, you just passed.
Right there.
I'm sorry that it's sideways.
No, I'll try to.
Yeah, so I like this report, and I just want you folks to spend a little time on it in the next couple weeks if you can, and tell me if you like it too, or if it's too complicated, or if it's easy to read. I just wanted to highlight that this week. And that's it on that part. Any other questions?
Motion to accept the June financials?
Isn't that what we
I think
just
we
did?
did.
Yeah, we did,
Yeah.
yeah. It's all one.
Yeah,
Yeah.
board, committee, and
Yeah, we
discussion.
did it all as one.
Yeah.
All right, we're good. You're done, Pam? Okay. Okay, at this time, at the board committee reports, and I'm sure you've had some community meetings, and why don't we start with Sue and Kelly on communications?
Communications, I don't have anything for communications, but for operations, I had a couple of things that maybe you didn't see in the minutes. Correct me if I'm wrong, Brent, but, because I can't read my writing, but it's August 4th and 12th, that's computer pickup, okay? So when people are thinking that we're paying attention to COVID, there's Brent, he's working on those computers, God love him. So that's going to be happening. In Brett's area, they, of course, have been working really diligently on getting supplies and the tools that they need for all of the sanitation that they're going to be facing. And James was very excited to let us know that all the buses have been stickered already.
Oh, that's
So
great.
that headache is out of the way. And with that going on, now they're using, with the new buses that they have, now they've got time to go over and fix all the other buses, which normally they don't have the time to do. So that was good news on their department.
And I'd like to add, I did have some emails from parents asking what cleaning products were going to be used, and they're under the minutes in that operations. So I encourage anybody who has that question to get online, and it goes through what the cleaning products that will be used or cleaning services, etc.
That was a really good question that Kelly had asked about that. It was something that honestly I hadn't thought about. And when he sent the SDS forms for all of those to us, I was actually a little put off by it. But James wrote back, as well as Brett, that these were things that they have researched, and the labels are a lot scarier than what they actually are. They have to put all these cautions on them. But the janitors are all trained in how to use these things. Everything that's around the kids or people is all food safe. So they're, if you look up those SDSs on those, don't be as put off as what I was. They're totally vetted and safe to use.
Okay, how about Gretchen? How about curriculum? Anything?
You know, we spent a lot of time just going over the plan and how instruction can be improved. And due to the fact that we do have the 2 in-person days, that will help with the online instruction. We really just discussed in general. That's it.
Okay, great, thank you. Mr. Bennington? Anything from your end, personnel and finance?
Yeah, personnel and finance both met this afternoon. Again, I heard Ms. Harrington's report, and we probably, again, I'll emphasize, we talked quite a bit about adding the encumbrances to our reports going forward. So we can start to see what those are, and it's kind of interesting to see them comparatively. So I think as we closed out, and I'll put you on the spot here, Pam, as we closed out June, encumbrances were around, you mentioned the number, $380,000 or so versus where the encumbrances were at the end of last year, which was around 2 million, 2.4.
Yeah, no, it's about 500,000 encumbrances, but left our balance.
Oh, $500,000. So, you kind of get a good idea of what the cash that's sitting out there at the end of the year, how much of that cash is committed for kind of current year spending that's yet to come in. So that'll be a nice improvement from suggestions from another board member. Personnel committee, look at what the highlight that Ms. Johnson walked us through was kind of this, again, the status of filling positions. It's like about 10 positions due directly to COVID, 10 positions were deemed were decided not to be filled. So there's about a $451,000 savings because of that. 9 positions that were filled for about $615,000. So when you take a look at what the 5-year forecast was for the budget of $1,035,000, and really we only spent, where am I getting my numbers mixed up here? We spent $615 on new positions. We spent $451 on positions that didn't go away. You're looking at a net savings of about $800,000 to the district during the year, or in the upcoming year, because of how that staffing rolled out. And again, it's kind of good work, great work on the part of Ms. Johnson and the rest of the administration team of really going through what is needed in the hiring and rationalizing that.
That's awesome.
Needs-based, the nice benefit is we see a nice cost savings from that as well.
Eric, did I see somewhere that we had one teacher resign?
I believe it's 3 teachers
Are we up to
resigned.
3?
That's right.
Yeah, and I'll speak for Mr. Pullman. He did a great job asking some questions, making sure that these positions that are being eliminated are going to have minimal impact on the operations, on the student experience.
Actually, if you look at 9 under certified personnel, you have 4 teachers. But yeah, like Eric says, in the personnel and the financial end, and there's not much more I can add to that, so I'll let it go at that. Thank you, Eric. Thank you for your committee report. Anybody else? Kelly, anything else you want to report from your committees?
Sorry, I was muted. No, that's it for me. Thank you.
Okay, thank you. Anybody else? All right, we're at the consent agenda, which takes us from item number 6 through item number 7 through 12. And again, it's resignations, it's contracts. You can take a look through there. And we did pull out 9.4, substitutes, classified personnel, fundraisers. So we need a motion to accept the consent agenda.
So move.
Second.
Any discussion?
Just wanted to highlight a couple of resignations, and again, some are due to, I'll pull them up on the board here, but some are due to COVID, just individuals wrestling with decisions, and sometimes people are moving just to take a different job or changing locations. But certainly we hire the best, and we're always sad to see those teachers move on or resign. But certainly this year, just an unusual situation, different conversations than we normally have. Just people, risk and benefit analysis and what they're comfortable with. And at Woodland, I don't know if Brooke wants to jump in on that, but we have the head cook at Woodland who is retiring. So we appreciate her service and all that she's done, for the district.
For quite a long time, so we definitely appreciate her and wish her the best of luck, and she'll certainly be missed.
Yeah, they do.
I agree. I worked with her several times doing the Donuts for Dads, the Muffins for Moms at Woodland, and she was excellent to work with. She will be missed, definitely.
Thank you, Mr. Hostler. Any motion? Did you get a motion?
He seconded down.
Okay,
Yeah.
all right. Roll call, please, Ms. Harrington?
Mrs. Downs?
Yes.
Mr. Bennington,
Yes.
Mrs. Eubank,
Yes.
Ms. Larimer,
Yes.
Mr. Pullman.
Yes. That takes us to new item 13.1, supplemental basketball pay for the camp. We have a motion to accept.
So moved.
Second.
Any discussion? Roll call, please.
Mr. Bennington,
Yes.
Mrs. Larimer, or Ms. Larimer?
Things happen faster out
Yes.
here. Yes.
Mrs. Eubank,
Yes.
Mrs. Downs,
Yes.
Mr. Pullman.
Yes. That takes us now to item 14.1, which would be the Board of Education resolution endorsing the Perrysburg Schools back-to-school plan to start the 2020-21 school year. What I'd like to do is just go around the horn, starting with you, Kelly, just give us your final comments. I think our discussion Friday, our discussion today, and questions that we're receiving and asking and talking to each other about one-on-one, we're ready to bring this to a vote today. So Kelly, you have the last minute comments before we bring this to a vote?
Sure. I'd like to say that I truly understand the complexities that go into developing a plan to open school. And we all know any decision that is made is not going to make everyone happy. And I want to acknowledge that all the parents and students that reached out to me through email, texting, your voice does matter. While there are no guarantees right now and no promises for normalcy, things will be different when the teachers and kids return to school in the fall. But for me, after looking at all the reports from the ODE, the ODH, the CDC, AAP, and data from Western countries where schools have been open, I firmly believe that we go back to school 4 or 5 days a week or 0. The hybrid model is for only going 2 days in person is not the best learning and unacceptable. That is not why people choose Perrysburg schools to educate their children, and that's certainly not what we pay for. You cannot replace the in-person learning. That is not debatable. When looking at the social and emotional needs of the students, the benefits outweigh the risks. The virus spread. Schools need to weigh risks of not being in school, mental health, falling behind academically, and substance abuse as well. In addition, as I mentioned before, I am not in favor of using the Wood County colored alert system for our school. I feel like the governor gave the school boards the decision and then in turn, turning the power back over and letting that decision be made through them. I would be in favor of creating our own color-coded system and not using theirs. And that's it.
Okay,
Thank you.
Thank you. Mrs. Larimer?
I want to commend our administrative leaders. The scope of what they have had to endure since March is beyond my comprehension. And I would publicly like to, if I could be on bended knee, thank you for all of the enormous work that you have done, the research involved, the interviews, the meetings. I am just so impressed with everything you've done. And I think our community, whether they agree with the plan, whether it's what they really want, they should be doggone proud of these people who have worked tirelessly all these months to provide for our children, our staff, and our community. That's just right off of the top of my head and from my heart. Everybody wants kids back to school 5 days. That's what's normal. And we're at the point now that everybody is craving normal. I mean, it's worse than one of my chocolate cravings. We want normal. It is that bad. But even though, honestly, I disagreed with an awful lot of what our guest speaker said tonight, she always prefaced it with bring them back safely. She didn't necessarily totally define that, but we heard social distancing as one of the main ones, washing hands, all of that. So if you incorporate all of these reports, everything we've seen with social distancing, you have to do a modified school year. You have to. You have to start there. And I think Ben Beatty said it best, where a conservative, cautious start is wise. And I think that's what our administrative leaders have done at, I'm sure, great sacrifice to their own sanity and health. And I am just really appreciative. As I mentioned earlier, there's a couple of things in the how-tos that maybe I don't agree with, but that's not relevant to this, to the basics of this plan. I think it's brilliant, and I'm in full support of it.
Mrs. Downs?
Way back when we had our first slides of what a classroom would look like if we had 6 foot of separation, I started worrying about how we're going to get our kids back to school. We all want all of our children in school all the time. That's why we run for school board. That's why teachers become teachers. That's why administrators become administrators. That's what we all want. First, I want to stress this disease is real and it's close. It's not happening in Texas and Florida, and we're all fine. I have a friend, and her daughter sang at a wedding. Her daughter did stay and have a drink, and then she went home. She did not attend the reception, and she has been in Toledo Hospital for 15 days so far. Her blood oxygen levels are starting to improve. So there's hope that she has turned the corner. This is a 34-year-old, totally healthy, no underlying conditions, young woman. At home, she has a husband and a 1-year-old and a 3-year-old.
Oh my.
And this is one of us. It's one of our kids. This is real. It's not, oh, it'll only happen to other people far away. We're safe here. We're not. That's the real. So when I looked at it, and back to the original premise, when I started thinking about it, I thought, you know what we can do? We can rent the Holiday Inn for a year. And we can move half of the high school to the Holiday Inn. There's a cafeteria. We can have a swim team right in the pool. We can do so many great things. And then I started thinking about hiring the extra 100 teachers it would take to put half the students in one school and half in the other. And I thought, wow, maybe this isn't such a great idea. And when I went past the other day, they've started to tear it down anyway. So, all kinds of options go through your head. And so as I finally came to the conclusion, knowing that COVID is real, knowing it is in our community as well as in states far away, I see 2 options. One option is to open the schools and hope for the best. The other option is take the recommendations of all the experts, of the health professionals, of the educators, of the administrators, and build a program. Right now, I'm struggling at home because I need a new roof, and it's expensive, and I don't want to buy a new roof. So I had 3 different roofers come look at it. All 3 said, you need a new roof. So I thought, okay, here are my 2 options. I can put a new roof on my house, or I can just hope for the best. Just hope that we don't get a winter where it rains and snows. hope that my roof will somehow not be as bad as they're telling me it is. Or I can make a plan as to how am I going to afford to have a roof put on. Well, it's obvious. I have to go with a plan to get this fixed. And that's the same thing I think we have for the schools. We can start as usual and hope for the best, or we can go with a well-constructed, well-thought-out plan that will provide for the best interests of our children. So I admire the plan. I do want all students in school all the time, but I think our teachers are up to the challenge of providing a solid education online and in the classroom. So I applaud the plan and I certainly support it.
Thank you, Mr. Down. Mr. Bennington?
Yep. Echoing what everybody else in this room has said, we all want our children back in the schools and back to some kind of normalcy 5 days a week as soon as we can. But as you don't really want a CPA talking about the efficacy of masks or the spread rate of children below 10 or above 10, how asymptomatic spread occurs. So with that, I rely on the experts. I rely, and particularly the local experts, and we've heard two of them and I've heard one of them speak twice now, and that weighs a lot on me. And I agree that I believe that this virus is real and this virus is in this community. And if anything, I'm probably more on the side, wanting all of our children back 5 days a week, I'm probably more on the side of a full remote learning environment because that's just, my risk tolerance is not that high when it comes to children. But I also believe in the importance of having children socializing again and having some routine back. And I understand how important that is to the parents. So my vote here is in full support of this hybrid plan because I also value the plan that gets us moving forward with the least probability of disruption for our students, for our teachers, for our community. I also agree there's 1,000 other questions out there about this plan. Every letter I read, and particularly one since Friday, have certainly pointed that out to me. There's a lot of questions that this group couldn't possibly answer right now. There'll be 1,000 more questions once we start moving forward here over the next 4 weeks. We've got 4 weeks. So what's key for me tonight is to give this administration, the teachers and the parents, the guidance, the plan, the framework, so that we can move to that next step and figure out all of the 1,000 other things that have to happen between now and over the next 4 weeks. So I also appreciate, respect, admire the hard work that's gone into this thoughtful plan. I also commend every one of these board members for the questions that have been asked, the thoughts that have been shared. I've seen us, some of us, most of us vacillate, let's go 5 days, let's go full remote, The discussion and the thoughtfulness has been there and is appreciated. I think that's all.
Thank you, Mr. Bennington. So being last, it's easy because I don't have to say much because I concur. I will say that I don't deal with observation as much as research in my job as statistician, as a math teacher. I like to know what the P level is going to be, what the level of significance is going to be, confidence interval. Let's look at things. But most of our studies are observations, which is statistical too. And let reports come out depending upon who you read, New York Times, Perrysburg Messenger Journal, Cincinnati Enquirer, Columbus Dispatch. They have articles. They put out information. So I read them. Yeah, it's a good idea. Well, that makes a lot of sense. And then you look at experts from the CDC, the ODE, and Gretchen. She invited us to continue to read back to the American Academy of Pediatrics and what they said. So as I review this weekend and continue to go back and look, it makes sense to me that when they say in the journal, the American Academy of Pediatrics, school policies should be guided by supporting the overall health and well-being of all children. And no matter what we do in our school policies, we're always looking at the health and well-being. What's best for that child? If it comes to bullying, if it comes to harassment, if it comes to abuse, that comes to need extra help with homework, what's best for that child. We talk about the social, the mental, spiritual, I guess you guys separate that from church and state. But the fact is, we got to get them in school. I'm not in favor of 5 days. When they tell me that when we do open schools, we're going to find that there will be some transmission of this COVID, and it will enter our community. So why should we go full boat when the CDC says, let's start out slow and then let's get bigger? I think about that mile runner who you train and you tell him in a 1600 meter dash, don't start the first quarter a sprint. You'll never finish the last quarter. Let's not sprint our first quarter. Let's open up slowly. Let's pace this. Let's observe. Let's see what goes on in our community with our kids. Let's be safe. And to Mrs. Down's point and Mr. Hostler's presentation, this remote education is not going to be like last spring. I know that teachers have been talking and preparing and will be thinking on those Mondays. There's going to be education take place 5 days. It's a different style. It's a new normal. But I know as a board and Mr. Hostler, superintendent, and the teaching staff we have working for us want the best interests of our students. And that is to give them the best education that we can give them. That's always been our goal. And so some will throw away and say that, well, these days that they're away is going to be like last spring. No, it's not going to be like last spring. They're going to be more held accountable. I'm in favor of the plan, Mr. Hostler. I thank you and your administration, the board for our conversations, for questions that's come up. We've traveled from not going to going 2 days to possibly of 4 days if our levels permit. We've come a long way. All the best interest of safety for our students, our staff, that's our secretarial staff, our bus drivers, our cafeteria workers, our teaching staff, and our community. Once we get open and we see that we're keeping them safe, as Mr. Hostler said, this plan is meant to be flexible. Plan to be flexible, safe, and adjust. I'm behind this plan, Mr. Hostler, and at this time, I'd like to have a motion to accept the resolution before us in 14-1.
So moved.
Second?
Second.
Any further discussion? Roll call, please, Mrs. Harrington?
Ms. Larimer,
Yes.
Mrs. Downs,
Yes.
Mr. Bennington,
Yes.
Mrs. Eubank,
No.
Mr. Pullman.
Yes. Motion is carried, motion is passed. Thank you very much again for all the time, board, and Mr. Hostler and your staff for getting a plan. And now I know it's not going to be easy because now the work begins. The work begins and more people become involved to make this happen. And we thank you for, now we know, both the community and the staff, what's next. At this time, we're at board discussion and open up for any discussion that you might have at this time.
Oh, sorry,
Oh,
Kelly.
I have a question. Oh, you go ahead, Sue.
All right, well, to anybody who's listening, I would like to publicly apologize for not getting to all the plethora of emails that have come my way, some directly to me, some to all of us. That's not my style. I normally will respond to an email within hours of receiving it. And some of them have just tore at my heart, as well as my knowledge. And I honestly did not know how to answer some of these emails. And then I would sit on it a little bit. Some of them I could get to and some of them I couldn't. So for all of you who I have not answered, please know that there's an email coming. You're owed one, you deserve one, and I am terribly sorry that I have not responded as my usual. You will get a response no later than the beginning of next week.
Anybody else?
I just want,
I had a question, Ray. Can you tell me, was there a fee or did we pay Dr. Hanrahan for speaking with us tonight?
I'm not aware of any fee.
No,
No,
she
no, Ms.
volunteered.
Hostler says no, she volunteered.
Yeah.
Great, thank you.
I have two things. One, I know everyone probably saw me looking at my cell phone all night. I was trying desperately. I can hardly read these screens. So I was trying to bring it up on my phone and I couldn't get it. So I wasn't sending emails to my best friends. I apologize. It looked very rude and I apologize. Second thing, before we adjourn, are we going to set up the special meeting for the week of the 27th?
Hopefully it won't take as long as last date we were looking for.
Yeah.
Yes, Mr. Downs, you're correct. We should probably do that. Is the 27th a good date, Mr. Hostler?
Yes.
Good for me. How about other board members?
If it's in the evening, I can do it. I
5:30?
can't do anything during the day.
Is 5:30 a good time?
It works for me.
Kelly?
Kelly, did you hear that?
Kelly, you good for 5:30?
I believe so. I don't have my calendar in front of me, but I believe so.
Mr. Downs?
27th at 5:30 works for me.
Okay, let's make it a date.
Are we doing Zoom or in person?
In person, is that, we're good with that?
Good with that.
Good, Mr. Downs?
I will say for those of us who are visually impaired, Zoom was much easier, but yes, I'm fine.
Well, it's a little circus today with all the technology.
Lessons. Lessons one more time.
All right, that's 2 sneezes. I
That's
gotta
right.
get out of here.
But he has a mask. We're safe.
At 5:30, did you say, Mr. Kent?
Yes, 5:30? 5:30. Okay, any other business, anything else to discuss? Okay, we have motion for adjournment, please.
So moved.
Second.
Roll call, please, Mr. Harrington?
Mr. Bennington?
Yes.
Ms. Larimer?
Yes.
Mrs. Eubank? Mrs. Downs?
Yes.
Mr. Pullman?
Yes, meeting adjourned. Thank you so much for your input and for your work on the Board of Education. Meeting adjourned. Oh.
Well, thank you, guys.